Right. Okay. Online people, can you hear me? Online people, can you hear me? All good. Right. I think we can start. So today it's it's part of our rapid theory coverage. We are going to finish the human skeleton section within this seminar. Right. Okay. So topic wise, we are doing the theory rapidly so that you can go to your 2026 August exam target, right? Within, I mean, less than 9 months now, right? 9 months, no? Right? So within that 9 months, if you want to cover the syllabus and also if you want to have enough paper practice, we have to get the theory quickly out of the way, right? So that's the plan I'm following right now. So we are going to have these sort of programs so that we can quickly get over with the syllabus, right? So, without any further ado, let's go into the topic that we have to discuss today. So, it's the final part of lesson 5, support and movement, right? So, you have so many sections in the lesson 5. We start with animal tissues, right? And then digestion, and then circulatory systems, respiration, immunity, excretion, like that. So, that's the end of grade 12. Right, and in the grade 13 you start with nervous system, then endocrine, then what do you have, reproduction, and the final part is this support and movement, right? If you take a look at few of the papers in the recent years, you might have seen, particularly in the structured essay paper, the weight given to support and movement is actually increasing, no? Almost one third of a structured essay completely, there's a chance. I have included in the tune almost one third of a structured essay could be from support and movement, right? And also increasing number of short notes, right? Such as curvatures of the vertebral column, describe a typical vertebra, right? Increasing number of essays are also being questioned from support and movement. Okay, so that's why you need to have a nice idea, hands-on idea, right? I mean, it's one of the rare situations in your syllabus that you can actually, I mean, I'm giving you the opportunity to sort of have the 3D idea. So you are able to describe it. Ne? එතන ගිහිල්ලා නිකන් පොතේ තියෙන diagram එක නිකන් 3D idea එකක් නැතුව, for example, ඔයගලන්ට thoracic vertebra එකක් දුන්නොත්, what are the foramens in it? What are the contact surfaces? Right? If you understand the mechanics of our chest wall, you can just describe it. Ne? There's a logic to it. අපේ බෙල්ල ගාවින් තියෙන vertebra චූටි. Right? පල්ලයට යන lumbar vertebra වෙනකොට they are getting bigger. There's a sort of physics of it. Right? So with this hands on, you will be able to get it to your understanding. So you can go home and study the right what you need to memorize. Right? So that's what we are planning to do here. And if we come to the support and movement lesson itself, it has 3 sections. No, I like to divide it into 3 parts. The first part is skeletal systems, right? Skeletal systems that you can observe in the living world, such as what? Basically, you have hydrostatic skeletons. What's the next one? Skeletons outside, located outside, right? Exoskeletons. And finally, like the one we are going to study today, the human skeleton, endo, right? Endoskeleton. ඇඟ ඇතුලේ තියෙන, right? Covered by soft tissues. So this part I have done, right? It's a small one for people who are haven't joined it, I'll send you the recording. Okay, chutti section එකක් තියෙන different types of support systems in the living world. Okay, because I'm not, it's sort of නිකන් එතනින් පටන් ගෙන human skeleton එකට එන එක bit නිකන් unmatching වගේ. So we covered that part. Was it week before last? Yeah, no, week before last, right? So the second part is our point of attention today, human skeleton, right? Human skeleton එක I think we are going to study in more than enough detail within today, right? Finally, we have muscles, right? We have the physiology of muscles, the anatomy of muscles, how muscles are composed of, how they contract, and the theory of muscle contraction. That also I have covered, right? Sliding filament theory, because that's also a bit unrelated to the bones, right? That also I have covered. So our attention is going to be human skeleton today. Okay, right? Online people, any questions, any connection issues? You can all hear me clearly, right? Yes. Okay. Any blurriness or anything? Nothing, right? All good, right? So human skeleton, we have what we call as an endoskeleton. Can you see your skeleton? What is the only place you can see your skeleton? I'm showing you my skeleton, right? The only place you can see your own skeleton if you are alive and if you are not injured. Like God forbid, right? ගෙදර යනකොට මොකක් හරි මේ වෙලා right කෙලිම බස් එකක් යට කරන් ගිහිල්ලා හරි කකුලේ බෝන් එකක් එළියට fragment එකක් ආවොත් හැරෙන්න. If you are a healthy uninjured person, what is the only place you can see? Your teeth. Teeth are part of your skeleton, right? So in this is a lower jaw, right? Mandible එක, right? And එක එක දතක් ඉතුරු වෙලා තියෙනවා බොහොම පරිස්සමෙන්, right? Very carefully. All the other teeth have fallen off, right? And this is the upper jaw, right? Can you see? Right? We call it a maxilla. Eketh, you have slots for the teeth to fit in, right? So maybe a dental student have got hold of it or that right? No, right? So we have a endoskeleton covered by soft tissues, muscles, skin, everything else, right? You cannot see your skin, right? It is providing us support from inside, right? Our muscles, skeletal muscles are attached to our skeleton. So skeleton maintains our body shape, provides support, and also provides levers for the contraction of muscles, therefore movement. All the movement that we do is because of skeletal muscles and also because of the bones attached to those skeletal muscles. Okay, right. So out of the way, what you see here, online people, can you see? You can't see the entire desk, I think, in your view. I'll show you everything close to the camera, right? All the specimens that you see here are real ones. Okay, so if you can come to the front. Okay, all specimens you see here are from real, real human ones, right? So maybe voluntarily, involuntarily, they might have donated, or they don't even know their skeleton is here, right? We don't ask how medical students get their skeletons, right? It's usually for sale. We don't know how they get it, right? But it's for learning purposes. So we think our intentions are pure, right? Our intentions are pure. So we don't think it's an offense or it's disrespectful or anything. Okay. So I might make jokes with them or use them. You are not supposed to use them as a, like, what do you say, Muppets, you can't use them, right? Even when we are doing anatomy, when we are dissecting bodies, we are not allowed to animate them. රූකඩ වගේ කරන්න we are not allowed. We are supposed to respect, right? So I want to get it out of the way, right? I might to just to keep it light, but always you have to sort of respect. It's a living person, right? It's not a cat or a dog or a fish or a skeleton. No. It's another human living being, right? So they are, well, maybe voluntarily or involuntarily, they have given their skeleton. ඒගොල්ලෝ ජීවිත කාලෙන් පුරාපු කාපු calcium and all the things are deposited here and now we have preserved it and we are learning from it. So our intentions are good, right? But serious note, right? Because if you go into medicine or whatever field that you are studying, human anatomy and human structure, human functioning, everything, the respect for human life is important, right? Because some person is donating their body, right? You know how careful you are of your body, right? කොච්චර පරිස්සම් කරනවද, you clean it, you take care of it, right? You give all nutrients and everything, right? Okay, so human skeleton. So I'll be using the software constantly, so to give you a 3D idea. So let's forget, did you see? Okay, forget about everything and let's focus on the human skeleton, right? We are very unique, no, in our sort of, as humans, our skeleton is very unique because of several peculiar reasons, right? For example, we are completely upright, right? There are no other bipedal animal who is completely upright, right? Tani killing backbone is completely straight. We are exclusively bipedal, right? Kakul dekin විතරමයි යන්නේ. Chimpanzees, they are arboreal, අතුවල එලිලා යන්න පුළුවන්. Their hands are very dominant also, right? That's one thing. We are very erect. We have a backbone that is very erect. And on the top of that backbone, what do we have? We have a skull with what we call as a cranium, right? මේක අපි කියනවා vault එක. Vault එකක් කියන්නේ මොකද? බැංකුවේ තියෙන අර safe එක vault එක, right? We call it a vault, but in your syllabus we call it the cranial cavity. Can you see the inside empty space, right? This is very large compared to our body size. The body size එකට compare කරාම our vault is massive compared to our body proportions, right? So maybe a horse or a elephant or maybe a blue whale may be having a larger brain than us, like in mass, but that's compared to their body, it's very small, right? But our compared to our body proportions, this is very large, right? So you will see it takes a lot of effort to balance our head on our backbone, right? Our head is very hard to balance. So you will see there has been a lot of design features that helps our body to balance our head on our neck, right? හොඳට balance කරලා තියාගන්න, because our head is very heavy and it's very vulnerable. Can you see? It's like, yeah, always it's completely disconnected from our body, right? චූටි section එකකින් it's only connected to our body, right? Very easy to damage, right? කපලා දාන්න lazy, right? So that's another interesting thing. Okay, so we can divide our skeleton into two parts as our sort of main sort of central structure that we call as our axis. You know, our axis is like අපි දෙකට බෙදුවොත් it's our midline, right? All the structures that are located in our midline that we call as part of our axial skeleton. And everything that is attached to the axial skeleton, side එකෙන් තියෙන ඒවා, we call what? Appendicular skeleton. Okay. Now people, can you see axial skeleton and appendicular skeleton? What are our So they are appendages of it, right? Appendages, our limbs, right? Upper and lower limbs. Two main parts, right? Our axial skeleton, appendicular skeleton. So we are going to first study about our axial skeleton. Before anything, let's come to our Bible resource book, right? Let's see what we can highlight and what we can cover there. Okay. Online people, take out your resource books. So, hope all of you have got the tunes, right? Yeah, I think yeah, it's available in the chat. Thank you. Right. Okay, I'll send to the group as well again. Resource book page number is what? Yeah. Right. The human skeleton. Okay. Human skeleton is divided into two main parts: the axial skeleton and the appendicular skeleton. Axial skeleton consists of the skull, vertebral column, sternum, and ribs. Right. What are the parts of our axial skeleton? Skull, උඩ ඉඳලා පල්ලෙහාට යමු, right? Skull, vertebral column, sternum bone, right? I'll show you all these. And also attached to the sternum, making our chest cavity, we have our ribs, right? I have few ribs here. We have our ribs, right? So in your tunes, I think the last pages are blank, no? Right? Those pages are for you to take some notes. Okay. I'm not going to give you a note because what is your note? Resource, right? එතන ඉහාට තව ඒකම ලියන්න ඕනේ, right? So in your last pages, you have some empty space. Write down what is included in your axial skeleton. Just small points, right? Then your your appendices, right? Okay, appendages, right? We have two special joints that help our limbs connect to our axial skeleton, right? We call them girdles, right? A girdle, right? We have two places where we have girdles. What are the two girdles that we have? Our upper limbs are attached to our axial skeleton by our pectoral girdle. Pectoral girdle, and our lower limbs are attached to our axial skeleton by our pelvic girdle, right? Pectoral is the upper, mainly the area surrounding our shoulder joint, right? Pelvic girdle is our hip joint mainly, right? So you can say attached to the pectoral girdle you have your upper limb, pelvic girdle you have your lower limb. We can come back to appendicular skeleton later. Let's finish talking about axial skeleton, particularly our skull, right? Skull licking. We have a lot of things to talk about the skull, right? Quickly take this down if you like. Online people, you can take a screenshot. Okay. So shall I erase this? Okay. Skull. How many? What are the things you can move in your skull? One of the skull like holland pula. Skull is very complicated, right? It's composed of a lot of bones, right? A lot of separate bones, right? අපිට නිකන් separate bones කියලා හිතුනහම the thing that comes to our mind is if it's composed of a lot of bones මේව නිකන් ඔක්කොම නිකන් හෙල්ලෙනවා වගේ, right? But even though our skull is composed of a lot of bones, they are sort of welded together, right? Immovable. Most of the bones that are in the skull are connected in an immovable way. We call them sutures, right? Suture lines, I'll show them, right? You can, when I pass them around, you'll be able to see, right? So, even though our skull is a complicated collection of bones, there's only one bone in our skull that we can move. What is that bone? The mandible, right? So, if you take, this is the skull, right? This is your jaw, right? Here, sort of underneath your ear, right? Ear එකට opening එකක් තියෙනවා, හිලක් තියෙනවා, right? මේ වටේ තියෙන පිනා එක, those things they fall off, no, those are soft tissues, cartilage. ඒවා ඉතුරු වෙන්නේ නැහැ. Right? Can you see? This is the ear hole, external auditory meatus, right? මේකෙන් තමයි sound ඇතුළට යන්නේ. Right? You can see, right? Come to the front, you can see. Right? So sort of underneath that, මෙහෙම there's a sort of a socket for the jawbone to fit in. Okay? දැන් නම් කර කර ගන්න, right? It can become සමහරවිට for the infections ඒ වෙන්න පුළුවන් ඒ joint එකේ, right? See? So the only joint that you can move in your skull is this what we call as temporomandibular joint. We'll learn about this. මේක විතරයි හොල්ලන්න, right? Okay. Then we can divide our skull into two parts. I mean, we can classify the bones into two parts. So, skull, we have yes. We don't call it the vault in your syllabus, right? We call it the cranium, right? Brain case කියලා වචනයක් තියෙනවා, right? In your syllabus, it's funny, right? Brain case. Okay, cranium and the facial skeleton කියලා we can divide the skull into two parts. Right? Cranium is brain case. Brain එක දාලා තියෙන case. Okay. So let's read a little bit about this introduction. Page number 72, skull. In humans, the skull rests on the upper end of the vertebral column. The human skull consists of 22 bones which are mostly connected together by ossified joints. Okay? Ossified joints. Those are called as sutures. Sutures කියලා කියනකොට සාමාන්‍ය මැහුම් වගේ නේද? I'll show you these sutures. Okay? ඒවා ඇත්තටම මහ පුතෙන් වගේ. Right? The skull is divided into cranium, brain case, and the facial skeleton or the face. The cranial bones, how many cranial bones do we have? We have 8. Okay? We have 8 cranial bones. Total කීයද එතකොට? 22 නේ වෙන්න ඕනේ. So how many in the facial skeleton? 14, no? Right? Let's name the cranial bones. Right? What are the cranial bones that you have? We have numbers of එක්කම, right? We have one frontal bone. Okay? 2 temporal bones. Okay? Then 2 parietals that we have. two parietal bones, one occipital. මෙතන කීයද? 6. තව දෙකක් නේ. There's two more that you can't actually see much, right? I'll show you them in the software. Ethmoid and the sphenoid. So these are your 8 brain case bones, right? Let's see if we can see those. මේක වෝල්ට් එක නෙවෙයි, right? It's a different volt. මෙයාගේ වෝල්ට් එක නෙවෙයි. තොපිය දාලා. Right? It's so several people have contributed to our lesson today, right? මේක මෙයාගේ වෝල්ට් එක නෙවෙයි, right? It's a bit of a bigger person, right? But I think this volt is this, right? මේ cranium එක මෙයාගේ cranium එක. Yes. Can you see? This cranium is his cranium. He saw her. Okay. Right. Online people, I'll show you this in the software as well. Right? What are the skull bones that you can see? We have, right? Can you see these sutures? Water, right? Can you see these sutures? Right? මෙහුම් වගේ, right? මෙහෙම නිකන් ඉරි ගිහිල්ලා තියෙන්නේ. Right? Those are immovable. Right? I can't move them. Right? නිකන් interlock වෙලා, and also because of the ossification, minerals in the bone itself they are sort of pasted together. You can't take them out, right? Separate. So this our sort of forehead area, sort of up to here, අපි නිකන් අර තමයි තට්ට පැදුනාම හැලා ඉන්නේ නැති. අන්න ඒ හරියට විතර යනකම්. That is the frontal bone in front. Right? Then we have immediately behind on the two sides we have the two parietal bones. Okay? And if we have to come to this part, this below bone with this big hole here included. This hole is the foramen magnum, right? I talk about this. This bone with the hole included is called occipital bone. And so part of the temporals, no, the temporals are here, right? The temporals are these two our sort of above our cheeks. We have two sides, right? Our ear hole, external auditory meatus, is part of the two temporal bones. Okay, temporal. අපේ temples කියලා කියන්නේ මොනවද? Temples මේ දෙපැත්ත. Right? අපි massage කරනවා. Temporal bone එක තමයි මේ massage කරන්නේ. Right? Because muscle tensions හැදෙන්න පුළුවන් in those two bones. Right? So shall we see the cranial region in the software, right? Online people. It's a bit dark now. Sorry, too bright. Light them off කරොත් online people, is it not bright enough? There's light outside. Sir, light the off. Okay. Will be right. I mean, am I covering? No, right? So this is our skull basically, right? If we zoom in, you'll be able to see the sutures. Right? They are what we call as ossifying joints. Right? So let's label what is this big bone located in front? Frontal bone, right? I'll select it. So the bone that is in the blue color now, frontal bone. Okay. In the end, I'm going to show you this and sort of test it, right? Right. පොඩි quiz එකක් තියමු අන්තිමට. There's a quiz built into this software. We can do it. Right. So that's the frontal bone. How many frontal bones do we have? Only one. Right. Then immediately behind it, we have this is one parietal and this is the other parietal bone. Two parietal bones you have in your skull. Then behind it, extending sort of behind and below your skull, we have your occipital bone, right? This is sort of our plug port for the spinal cord, right? So this is the opening through which your spinal cord goes into your brain, right? Yeah, main HDMI cable එක ගහන එක තමයි, right? Okay, main plug base. That is so that these are MCQ points, right? Foramen magnum we call it, right? Magnum කියන්නේ ලොකුම opening එක වගේ, right? Biggest. Foramen magnum is located where? Occipital bone. Okay, we are zooming out, right? That is occipital bone. So these are our two, one of the temporal bones, right? Can you see this is the ear hole? Sorry, yes, ear hole, right? And if we zoom out, you can see the other temporal bone here. Okay. Okay, ligaments. The ligaments are remaining. I'll remove these ligaments. Oh, yeah. Right. So that is the visible. Those are the visible parts of your brain case, right? Now we have to see some of our hidden. So how many did we see of the 8? Only 6, no? Then neck hidden, then neck missing, because that's because we have to sort of take these two pieces to see those two people, right? What are the two missing people? The ethmoid and the sphenoid. On the frontal bone එක ගලවුවාම we are able to look inside our brain case and we can see this bone. Can you see? It's like a bat. I'll remove one of the two of these parietal bones also, and I'll select it. Can you see? It's like a bat. It's called what? Sphenoid, right? Sphenoid bone. It's a complicated bone, right? A callus you can see from outside also. A part of it you can see out from outside, and mostly it's located inside the skull, right? This is your sphenoid bone, and the ethmoid is actually very small, right? Actually, in this software, yes, this is the ethmoid bone, right? It's sort of part of our posterior nose, posterior nasal spaces, we call it, right? This is the ethmoid bone. Can you see blinking? Ethmoid bone. ඒක නම් most, I mean, very hidden. You have to see it මේ නිකන් through our eye socket එකේ middle wall එකකින් you will be able to see the ethmoid bone, but mostly hidden, right? Mostly hidden. It's located deep inside the skull, right? Yes. So those are the cranial bones. Any questions, online people? You can see shape එකේ, right? Right? Can you see me now? Right? Okay. We can next move on to talk about the face, right? Facial skeleton. What are the bones in the facial skeleton that you can see? I'll show them in the software first. Already got 3D idea, you know, right? Facial bones. So, ඔක්කොම bones කීයද skull එකේ? 22. 8 we saw. We have 14 to left to see. Teeth ගණන් ගන්න නැහැ, right? එතන 32ක් ඇවිල්ලා එතන 40 කොතරක් වෙනවද? Like 40 පයින්නවා නේ. Right? We don't consider teeth, right? Teeth ගණන් ගන්නේ dental students ලා විතරයි. Right? You don't need teeth to be a complete human. Without teeth you can survive. Right? I'm discriminating against dental students, right? Right? Okay. So අපි මේක full කරලා ඉමුකෝ skeleton එක complete කරලා. ඔන්න ඔක්කොම ආවා. Alright. Now it's more complicated, no? අර ගියා. Can't you keep only the skull එක විතරක් තියන්න බැරි? Okay. Right. So face. අපි most obvious structures වලින් ඉඳලා පටන් ගමු. Right? This is one big bone. අපේ උඩ දත් ටික set වෙලා ඉන්නේ. මේකේ even though this software shows it as two pieces, it's actually one bone that is fused. අපි එක bone එකක් විදිහට consider කරන්නේ. It's called the maxilla. Right? It's where our upper teeth are embedded. The ridge for upper teeth. Maxilla. Right? So you can see it forms our අපේ eye socket එකේ lower border එක හදන්නේ by the maxilla. Okay? And it sort of forms the base of the nose as well. Nahaye bony part එක තියෙන්නේ. Right? Nahaye its nose is partly cartilaginous and that part is bony, no? Right? Part of it is formed by the maxilla. So this is the maxilla. It is actually two fused, left and right pieces දෙකක් තියෙනවා. And these two pieces are our nasal bones. Right? නහය කැඩෙනවා කියලා සාමාන්‍යයෙන් අර boxing වලදී එහෙම ඇත්තටම maxilla එක තමයි fracture වෙන්නේ. But the nasal bones can also get fractured. There are two nasal bones. Fuse වෙලා තිබ්බ කියන්නේ we consider them as two nasal bones දෙකක් තියෙනවා. Right? Online people, can you see the two nasal bones? This is one, this is the left one. Okay? Right. දැන් කීයද එතකොට? 3යි. Right. තව ගොඩක් තියෙනවා. Then what are the other obvious ones? මේක හොඳටම දන්නවනේද? This is called the mandible. Right? Lower jaw. Okay? And if we go to this side, this is what we call as our cheekbones. Cheekbone. Right? Genetically, සමහරවිට ඉස්සිලා තියෙනවා, සමහරවිට බැහැලා තියෙනවා, right? It can be sharp, it can be, right? එක එක විදිහට තියෙනවා. So this is that cheekbone that is called the zygomatic bone. Zygomatic bone. Right? Maybe this is the right zygomatic bone. If we come to this side, this is the left zygomatic bone. Okay? Right zygomatic bone and the left zygomatic. මෙතනදී මම මේක interesting දෙයක් කියන්න. Right? So what is this bone? This is the temporal bone. No, it's part of the cranium. Right? That temporal bone and this bone, that is the zygomatic bone, they are connected. Can you see? When method. Right? That is, and this is called as the zygomatic arch. මේ දෙන්න එකතු වෙලා මෙහෙම හදන this sort of a bridge වගේකට අපි කියනවා zygomatic arch එක. අපි මෙහෙම උඩින් බැලුවොත් can you see, you will see able to see there's a gap there. මෙතන හිස්තන. Right? So this is the zygomatic arch. Can you see? The zygomatic bone and the temporal bone join here and zygomatic arch. It's very easy to fracture. Zygomatic arch could you have to repair it with titanium mesh net දාලා ඒ වගේ they have to do some facial surgery to repair it. නැත්නම් එතන නිකන් වල වෙනවා. Right? It's very easy to fracture this zygomatic arch. Right? And you can see මේ mandible එකේ මෙන්න මේ කෑල්ල it goes into that zygomatic arch. Right? Part of the mandible fits in there. When මෙහෙම උඩින් බැලුවාම you will be able to see that. Right? I'll show them with the real skull as well. දැන් එතකොට කීයද? මම count එක මිස් වෙනවා. It's fine. Right? So the two zygomatic bones as well, right? මේක මොකද උනේ? Then let's go inside the nose, right? නහය ඇතුළට යමු මෙහෙම. You can see our inside our nose is very very complicated, right? Inside our nose is very very complicated. That's because you will see, and we learned in respiratory system that we need to humidify, warm, right? Like then sort of filter the air we breathe, right? මේ ඔක්කොම කළා නිකන් නැත්නම් කටෙන් හුස්ම ගන්නව නහයක් කියලාක් ඕනේ, right? Because our nose performs so many functions such as humidifying, warming up, filtering the air, right? So to do that, our nose has to have this so many passages, right? Those passages are මේ complexity එක ඇවිල්ලා තියෙන්නේ because of bony structures. Okay? So this is the separating part. අපේ නහය දෙකට බෙදෙනවා, right? That is actually part of the ethmoid bone. Ethmoid bone is part of our the cranium. Ethmoid bone එකෙන් තමයි නහය left and right වලට බෙදලා තියෙන්නේ. Right? That is not part of the facial. Okay? Facial skeleton එකේ කැලක් නෙවෙයි. Right? Can you see these two? මෙතන එකක් තියෙනවා. This is the inferior concha, right? That we call as the nasal concha or inferior concha. ඒ වගේ දෙකක් තියෙනවා. Left and right inferior concha, right? And let's remove this maxilla, right? Let's remove this maxilla and the that ටික තමයි ඉතුරු වෙලා තියෙන්නේ, right? So you can see the two conchi floating නේ පා වෙනවා, right? And there's a bone here that we call as the worm. නිකන් piece of tissue with a very thin, right? Very very thin plate like bone, right? That is called the worm. It's part of the facial skeleton as well, right? අපි මේ දත් ටික අයින් කරමු, right? එක එක අයින් ගන්න වෙනවා නේ. දත් එක එක ගලවන්න වෙනවා, right? Right. You know the different types of teeth, right? So I removed some of the teeth. What are the different types of teeth? මේ ඉස්සරහම තියෙනව මොනවද? Incisors. You just have to know the names in your syllabus, right? මේවා තමයි අපි කපන teeth, right? Cutting teeth. And මෙතන ඉන්න you can't, in humans we can't clearly identify them. This is one of our canines, right? උල් දතක්, right? And in sort of in the end of our jaws we have our molars, premolars, so okay, grinding teeth, right? On the අඹරන teeth, right? Then inside our mouth we are able to see one of, I mean, another part of our facial skeleton that we consider. This is called the palatine bone. There's a right palatine bone, left palatine bone. ඒක අපේ mouth එකේ roof එක හදන, right? Palatine bone. Okay? Then if you look underneath, so that's it, right? Two palatine bones, vomer, two concha, maxilla, zygomatic. That's it. I showed you all the facial bones. Anything missing? Any bone missing? Let's complete the model. What are the bones that you can see here in this? Online people, you are here, right? So what is this bone? This one? Maxilla, right? මේකත් maxilla bone. මේ දෙක මොකක්ද? Those are inferior nasal conch, right? Inferior nasal conch. මේ දෙක මොනවද? Two nasal bones, right? These two, මෙතනත් එකක් තියෙනවා. There's another one here. Those are zygomatic bones, right? Zygomatic. Okay. Facial skeleton. Let's list down the different bones, and then we can highlight the resource. Then we can do some questions. Okay. Let's list down the parts of the facial skeleton, right? How many do we have? 14, no? Yeah, the matakaine, what are the 14? What are the 14 bones? Mulima, in the order I taught, there's one maxilla, right? Maxilla වලින් එකයි තියෙන්නේ. Nasal bones කීයක් තියෙනවද? දෙකයි. Two cheekbones, zygomatic bones දෙකක් තියෙනවා. What else? Coming into the nose, we have lower, that sort of complicating part of the nasal cavity. We call them inferior conchi, right? I'll explain about this conchi again, right? Inferior nasal conchi, we have two. Then there's a sort of a separating wall part of the wall separating our nose into two parts. We have a bone called the vomer, very very thin bone, na? Vomer එකක් තියෙනවා. What else? Palatine bones, right? What is our palate? Remember, if you press with your tongue, you can see අපේ නහයයි mouth එකයි වෙන් කරලා තියෙනවා. There's a separate roof එකක් තියෙනවා නේද? The roof of our mouth කියලා කියන්නේ, right? There's a roof to our mouth, right? So that is called the palate. It actually has two parts. We have a hard palate and a soft palate, right? The front part of it, can you feel? Feel with your tongue. It's hard, no? It's bony. It's composed of the two palatine bones. පිටිපස්ස බලන්න. The sort of the rear end of your palate is, it's pressing, ne? එබෙනවානේ. It's called the soft palate. It's composed of muscles, right? You can move it, ne? Singers ලට පුළුවන් palate එක උස්සන්න පහත් කරන්න කියනවා. අර nasally sing කරන්න කියනවා. අර like bass sing කරන්න මොකද කියන්නේ? Soprano and right, high pitch, low pitch sing කරනකොට these singers can like move their palate. That is the soft palate. Bony palate එක හැදිලා තියෙන්නේ the palatine bones, right? We have two palatine bones. ඒව move කරන්න බෑ, right? එතකොට කීයක් තියෙනවද? 6යි 8යි 9යි. What else? Mandible, අමතක වුණා, right? There's one mandible. What else? Two conchi, vomer. What else? What is the other bone? What are the other bones? Frontal also we sometimes consider as part of the facial skeleton, frontal bone, right? What else? Conchi we considered the two palatine, zygomatic, maxilla. What else? What's not here? The two lacrimal bones, I couldn't show you, no? The two lacrimal bones, it's part of our sort of eye socket, okay? It's sort of deep in our eye socket. I couldn't show you. Right? Next time I put the software on, I'll show you. Right? We have the two lacrimal bones. Right? Lacrimal bones, they are part of our මේ අපි මේකට කියන්නේ orbit එක කියලා අපේ eye socket එක ඇතුලේ. It's part of our inner wall of our eye socket. Right? The two lacrimal bones. Lacrimation කියන්නේ මොකද? කඳුළු වෙනවා කියන එකනේ. Lacrimation කියලා කියන්නේ it's like a posh word for tearing up, right? Producing tears. So they are very close to your lacrimal ducts, so kandulu ducts, tear ducts, right? Lacrimal bones you have two. So count එක okay now. Only 13 because we consider frontal also, right? Neither. Read the list. In addition to the frontal bone, two zygomatic or the two cheekbones, the fused two maxillae. We are considering two maxillae, no? That's right. Maxilla we are considering as two, right? Left and right maxilla. Two nasal bones, two lacrimal, the vomer, the two palatine bones, two inferior conchi, and the mandible, right? So talking about this conchi a little bit, conchi, yeah, it's a bit weird name. This nasal conchi I told you are there to complicate your nose. So if you look at your nose without the cartilages, it's like a triangle. This upper part is composed of what? Two nasal bones, right? And it is divided into two sides, right? Left side and the right side. Usually ගොඩාක් අයගේ මේක මෙහෙම nicely නිකන් මෙහෙම straight wall එකකින් නෙවෙයි separate වෙලා තියෙන්නේ. It's usually මෙහෙම deviated, right? Even in this skull, I'll pass this skull around. You'll be able to see. I don't know if online people can see. This wall is, can you see? මෙහෙට වෙලා විලනේ තියෙන්නේ. Right? Almost 80 to 90% of people, this middle wall of the nose is not symmetrical, right? Hari straight line එකක් නෙවෙයි. So if you had a common cold, right? Yeah. එම්බිරිසාවක් ඇදලා තියෙද්දි එක නහයනේ හැම වෙලාවෙම බ්ලොක් වෙන්නේ. නහය එක පැත්තක් නේ බ්ලොක් වෙන්නේ. කොයි පැත්ත බ්ලොක්? Usually. Which nostril? හුස්ම ගන්න බැරිම කොයි පැත්ත? Personally it's for me the left side. That's because I have like seen, right? My septum is deviated to the left side. එතකොට when there is an infection or inflammation එකක් ආවම ඒ පැත්ත ටක් ගාලා බ්ලොක් වෙනවා. Because why? There is no space on that side, right? Can see, right? In this other skull, it's not very preserved, right? මේ skull එක it's not a very preserved skull, right? ඒකේ there is no septum, right? කුඩු වෙලා ගිහලා, right? It's not very preserved, right? Right. Okay. So I was talking about this nasal cavity. Let's imagine it's a nicely equally divided nasal cavity. This upper part is composed of what bone? This upper part of this nasal septum or the wall is composed of what? It's actually part of the ethmoid bone, right? It's not that important, right? But the middle part, or let's say the lower part, this section is composed of what bone? The vomer, right? Vomer bone. That is important, right? Because you need to know the vomer as a bone. And on these two sides, you have what I'll call them inferior nasal conchi, right? Atrama, there are three conchi, right? There's a superior nasal conchi, there's a middle nasal conchi, there's a superior one, there's a middle one, this is the inferior conchi, right? The thing is, මේ දෙන්න are composed of muscles and soft tissue, right? The උඩ conchi එකයි මැද conchi එකයි superior and the middle conchi are composed of muscle and soft tissue. So they are going to decompose, right? They are not part of our skeleton. But the two lower conchi are bony, So they are going to remain in the skeleton, right? That's why natham balanawa, right? So if there is something inferior, why are we calling it only one nang inferior? Because no, there's a middle one and a superior one, but they are not bony, they are soft. So they are going to decompose, right? You can draw this structure of the nasal cavity if you like, right, as a rough small diagram, right? These are what මේ උඩ තියෙන්නේ අපි කියනවා ඒකට අපේ nasal bridge එක කියලා. nasal bridge එක මේක නහය කැඩුනහම අර එහෙම ඇද වෙලා තියෙන්නේ, right? These are our what? Two nasal bones. This is the vomer. Inferior nasal conky label, vomer label, ethmoid bone, part of the ethmoid bone label. I'm sorry, I haven't sent the tube. Ne? I have selected it and I haven't sent the tube. Okay, anyone who haven't yet got the tube, I'm sending it to the group again. Right? Draw this small diagram of the nasal cavity. Yeah? Right? Come to the resource book again. Let's read under the cranium region. Okay. Human cranial capacity is nearly 1.5 liters. Right? Of course, that is different. What are the things that is differentiating the cranial capacity? Race. Race second. Right? Certain races have different larger skulls. Right? And what else? Gender. Right? Usually female cranial capacity is small. Right? Usually female cranial capacity is smaller. Okay, that is sort of common to all components of a typical female and a male, no? Right? Usually females are smaller in stature compared to the average male, right? Average female is smaller than the average male, right? So cranial capacity number highlight, it's about 1.5 liters, right? So මේක අපි මේ holes ටික plug කරලා වතුර පිරෙව්වොත් 1.5 liters it can hold, right? What else? Cranium protects and encloses the brain. Brain is located inside here. It also protects the inner ear, middle ear, olfactory organs, and the eyes. What are olfactory organs? Smell. Organs of smell, right? If you haven't done, have you done sensory organs? Eye, nose, ears, you have done. Our nose is actually like embedded into our ethmoid bone, right? So our nose, I mean, the nerve endings that are sensitive to smell are actually embedded in the bone, right? Okay, I'll show you if I have time this olfactory, right? Then of course our inner ear and the middle ear. What is outer ear? The part that is outside. That is our, we call it the pinna, right? Pinna of the ear that is located outside. That is the outer ear. Middle ear and inner ear are located in the bone. In what bone specifically? temporal bone. Then on the inferior surface of the cranium, there is foramen magnum. Highlight foramen magnum to provide passage to the spinal cord. Monkey way. It's like the big plug base, right? Two smooth rounded knobs, the occipital condyles on the either side of the foramen magnum, articulates with the first vertebrae, the atlas, which permits nodding. I'll explain this when we are doing atlas, okay? So, chuttak tiyala yanneka. Why is it blurry? The board, is it blurry? Line people? In this hole, I think there's better signal, no? I wouldn't. Right? So, go to the next paragraph. In the cranium, soft membranous regions called fontanelles are present, which allow slight compressions at birth, facilitating parturition. Fontanelles become replaced by bones within 1 to 2 years of life. Immovable joints, sutures are present between skull bones to provide more protection. Right. So we need to talk about fontanelles. Fontanelles. What are fontanelles? Fontanelles තියෙන කාගෙද? Do you have fontanelles right now? No. They are present in babies. Up to about 1 year, you can have from birth to 1 year. I mean, even more than 1 year, right? Yeah, 1 to 2 years, you can have fontanelles. Why is that? Because if you, I don't have a complete pelvis here, right? Then, hold on. First, you have to figure out are they the same side kill, because these are not of the same skeleton. Na? These are sort of like this. This is right side. This is left, no? No, nice. Right. Gone to left and right there. See. Okay. So these are pelvis, right? Oh, cool. Okay. So what has to happen? Underneath here, right? Below this, I can't. I'll show you this with the software again, right? Underneath here, you have the vaginal opening, right? The baby has to come through the vagina here, right? So the baby's head is the moist part. The shoulders collapse, right? They can also sort of fold because the baby's joints are not very sort of strong as ours. They can sort of fold, but the only thing that you can't compress is the head. So the biggest problem in a natural birth, we get a normal right? Normal vaginal delivery hekati. The most challenging, the most painful, and the most dangerous part is taking the head out. Right? So usually in a normal, like an let's say uncomplicated birth එකකදී මුලින්ම එන්න ඕනේ කොයි part එකද බබාගේ? Head. මුලින්ම ගන්න ඔළුව. right අපි කියන බබා හැරෙනවා කියලා. Have you heard these terms අම්මලා කියන්නේ? water break වෙලා බබා හැරිලාද කියලා අහනවා, right? right බබා හැරෙනවා කියලා කියන්නේ few hours before mother feels the contractions, the baby start to turn, right? කකුල් ටික යටට දාන්නම් හිටියේ බබා හැරෙන්න ගන්න. So that the head is facing downward. So the head comes out first, right? So the purpose of having these fontanelles are, I mean, that those fontanelles are actually, if you take this cranium, if you take a baby, they are not fused tightly like this. There are gaps. I'll show you a diagram, right? They are not maybe fused. Have you touched a baby like a newborn baby? Yeah, newborn right? Have you ever touched a newborn baby? Right? මෙතන අපි කියන තෙල් වල කියලා අහලා තියෙනවද? තෙල් වල කියලා කියනවනේ. Right? There's a yes, පිටිපස්සෙත් තියෙනවා. There are several fountains on these sides also you have. The biggest one is here. Those are places where the skull bones or the cranial bones are not connected. There's a gap. That's because the baby's head can compress slightly. It can compress slightly, so when it's coming through the vagina, it can reduce its size a little. චුට්ට පොඩි වෙලා අම්මට පොඩි help එකක් to the childbirth. It's helping, right? But when the child gets older, those spaces become filled with the bone and they become connected, right? So those are fontanelles. So they can ask you in the structured essay paper, what is a fontanelle, right? What is the definition of a fontanelle? Soft membranous regions which allow slight compressions at birth, facilitating parturition. That's the definition of a fontanelle. Then they can ask in the MCQ paper, fontanelles become replaced by bones within 1 to 2 years. Okay, clear about fontanelles? Then I think I'll have to show again with the software. I have told you, balancing our skull on top of our vertebral column is a real challenge. It's a real challenge because why? It's very heavy. Tadi brain is inside, and our neck is not very strong, right? Our neck is not very strong. If you have seen, if you take a car, most of the modification that we have done to a car, the headrests and the seat belts are everything, and the airbags are all designed to do what? To stop the head from like බෙල්ල hyperflex වෙලා හරි hyperextend වෙලා හරි neck එකට damage වෙන එක නවත්තන්න headrest, right? That's because our head is very heavy, right? And our neck is not very strong. So if our head can move abnormally very easy, right? Abnormally head එක move වෙන්න පුළුවන්. If you have seen these MotoGP riders, motorbikes, they have this sort of a neck guard එකක් තියෙනවානේ to prevent the neck going from overextending to the side to side or front to back. That's because it's very easy to damage our neck because of the weight of our head, right? So our head is anyway very heavy, but our sort of evolution has taken some steps to reduce the weight of our head by a little amount at least. That is by having these sinuses. Sinus එකක් කියලා කියන්නේ any empty space, right? So in our head or the skull, we have some sinuses, right? Those sinuses are located in some of the skull bones. The biggest one is in the frontal bone here, right? And on the two maxilla also we have sinuses. And what else? Ethmoid and sphenoid also have. Yes. They can ask you what are the bones in the skull that have sinuses. Right? I'll show you these all automatically, right? Ethmoid and the sphenoid bones also have sinuses. Okay, highlight in your resources. Go to the back of the tute. Go to the back of the tute. Go to the back of the tute and write down a small topic. Write down a small topic. Sinuses. Topic sinuses. Sinuses. Write down air-filled cavities. Air-filled cavities. Lined by ciliated mucous membrane. Lined by ciliated mucous membrane. දෙක යටින් ලියන්න. Next point, line by ciliated mucous membrane. Communicating with the nasal cavity. Communicating with the nasal cavity. Communicating with the nasal cavity. Next one, providing resonance to voice. Below that, and reducing the weight of the skull. And reducing the weight of the skull. Reducing the weight of the skull. So if they ask you in the structured essay paper, what are the functions of the sinuses? Name two functions of sinuses. Reduce the weight and provide resonance, because these are empty spaces. When we are talking, actually, sound waves travel through solid medium, right? Speed එක වැඩිම solid වලින්, right? So our entire skull is vibrating when I'm talking, right? But because these sinuses are empty spaces, I'll show you a cross section, right? In these specimens you can't see, right? You have to have like a, but in the other skull I think you can, because it's decomposed in the, you can see, right? Like a damage වෙලා හින්දා, can you see, this is supposed to be the maxilla මෙහෙම smoothly තියෙන්න එපා. Can you see it's gone inside? මේ කඩාගෙන ගිහිල්ලා තියෙනවා පේනවා. That is the two maxillary sinuses. It's empty inside, right? So this maxillary bone is empty inside. That skull is preserved. ඒකේ maxillary bone is okay, right? There's one opening. ඒක මම කඩලා. Right. When I got it, it wasn't there. Right? In this skull you can, right? On this side, the maxillary bone is okay. On this side, can you see? There's a hole. That hole is opening into the maxillary sinus. So the maxillary bone inside is empty. His, right? Similarly, here in the frontal bone also you have a maxillary sinus. And also if you take a look inside, this is the sphenoid bone or vowlek wage, right? There also you have air-filled cavities. Inside the ethmoid bone, which you can't see, there are air-filled cavities, right? Sinuses. Then what is the other thing that I mentioned? Air-filled cavities and lined by ciliated mucous membrane, right? So these sinuses have a mucous membrane. This mucous membrane, and the other thing is what? They are all communicating with the nasal cavity, you know? නහයත් එක්ක connected. නහයෙන් එන්න දේවල් මොනවද? Dust, air, and what else? Viruses, bacteria, everything that can cause infection. Everything comes through our nose, right? So if something is connected with our nose, that means what? They can also get whatever these pathogens coming through our nose. So if you are breathe in a virus, that virus can go into your sinuses and cause inflammation. You have done immunity, right? You know what is inflammation is, right? It can cause an inflammation in these mucous membranes, leading to what? ඕනම තැනක inflammation එකට කියන්නේ මොකක්ද? Any inflammation. It's usually with the suffix itis. Itis. So sinus එක inflame නම් it's sinusitis. Okay. Pancreas එක inflame නම් pancreatitis. Our examples here. Oh, yes. Gastric mucosa එක inflame නම් gastritis. Liver එක inflame නම් hepatitis. Meningitis. The meningeal layers of your brain. Meningitis. Anything else? Tonsillitis. The tonsils in your throat. Bronchitis. Lung bronchioles. Oh, again, itis ගොඩක් තියෙනවා. Right? Sinuses inflamed. it it doesn't have to be a virus or a bacteria. සමහරුන්ට නිකම්ම inflammation එනවනේ as a sort of allergy, right? So for me personally, I have a dust allergy. අර dust mites රෙදියස් කරනකොට එහෙම I get runny nose and sometimes headaches. That means what? Sinuses are inflamed. Sinusitis. Okay. Right. Moving on, read the resource book, come back to the resource book. Online people, any questions? Do you have any questions? No. Facial region is situated below the cranium, right? Some facial bones form the walls of the posterior part of the nasal cavity and form the upper part of the air passages, right? I told you behind part of the nose and the upper part of the air passage. That means what? Sort of the upper part of the throat, right? Those are all composed of bony skeleton, right? Bony parts of the facial skeleton, right? Upper jaw is fused with the cranium, right? You know, our maxilla is fused with the cranium. You can't move it, no, right? Lower jaw mandible is movable. Hard palate and soft palate separate the buccal cavity from the nasal cavity. What is buccal cavity? Oral cavity, mouth. So what is the two? What are the two parts of the palate? I mentioned this. Right. If you want, you can write these down as short notes. Palate is hard and soft. Hard palate is composed of what? Two palatine bones. Soft palate is cartilaginous. And also some smooth muscles are there. Okay. Cartilaginous mainly. Lower jaw articulates with the cranium. Zygomatic arch. Right. Zygomatic arch formed by the parts of the zygomatic bone and the temporal bone provides the surface for muscular attachment for moving the lower jaw. Right. Let's read about it completely. The lower jaw or the mandible contains two processes. Condyloid process, which articulates with the temporal bone to form the temporomandibular joint, and the coronoid process, which gives attachment to muscles and the ligaments. Okay. Mandible. This is the mandible. Two processes. We usually call something that is sort of sort of prominent. Usually giving rise to, sort of giving surface to muscle attachment. We call them processes. Your mandible has two processes. This pointed one is called a coronoid. Okay, coronoid process. This sort of rounded one is called condyloid. Right? Coronoid process gives an attachment to muscles that helps you to bite. Right? Can you see that mitigana? When the thing pushing out, you can feel some muscles pushing out. That means what? Muscles attached to your coronoid process are like pulling the jaw up. That means that because these muscles are contract. Make our sort of sliding. The joint itself is by the condyloid process. So I told you it fits into a sort of a socket here. So in that socket you can move the mandible, right? So the power to move it comes from what? The muscles attached to the coronoid process. Okay. So if you can, if you like, you can draw a small mandible, right? If you like, you can draw a small mandible, right? We have our coronoid process and we have a smooth condyloid process. This is the angle of the mandible. The sharp angle, that's genetics, right? Right? And this is the angle of the jaw, right? The sharp angle, right? And So it goes like this, right? This is a typical mandible, right? Anit පැත්ත අඳින්නේ නැහැ. Okay? This is what? Coronoid process. This is the condyloid. This you have the teeth attached here, right? If you like, draw a small rough diagram of the mandible. I forgot to mention the zygomatic arch, no? Right? What are the two components of the zygomatic arch? I'll write here. Zygomatic arch, or what we call as the cheekbone, that sort of prominence is composed of what? The zygomatic bone and also what? Temporal bone, no? Temporal bone එකේ the part of the temporal bone that is connecting with the zygomatic bone to form the zygomatic arch is called what? Zygomatic process. Got it? Zygomatic arch. If they ask you how is the zygomatic arch formed? By the zygomatic bone and zygomatic process of the temporal bone, right? Temporal bone has several processes. Huh? We'll come to talk about it, but focusing on the zygomatic arch method that is composed of those two points. If you like, මෙතෙන්ට you can add some additional information for muscle attachment කියලා ලියන්න පුළුවන්. And condyloid process, we call this joint temporal mandibular. I'll show this all of these again in the software, right? Temporal mandibular joint. Online people, you can see this edge. मेरे बनाने. Yes. Any questions online? What about you? Any doubts? No. Chip. Okay, shall I erase this palette part? Let's talk about the temporal bone a little bit. The temporal bone, which is part of what? Our cranium. It's a bit complicated, right? This temporal bone. Okay. Uh, that's the thing. One of these processes are broken, right? Anyway, where is the exact temporal bone? Can you see this margins? මේම ගිහිල්ලා මෙතනින් ඔහොම ඇවිල්ලා මෙතන. This is the zygomatic arch. So this is called the zygomatic process of the temporal bone. This is the zygomatic bone, right? This is part of the temporal bone. That is, this piece is called zygomatic process. That is one of the processes. තව දෙකක් තියෙනවා. Here, this one. එතන එකත් ඇත්තටම කැඩිලා on this side it's better. This piece, can you see that is prominent, I mean sort of prominent යට? This is called the mastoid process. Okay, the මෙතන mastoid process එක කැඩලා. If you can see, this mastoid process is full of air cavities. එතනත් it's, I mean it has some empty space. Here the mastoid process is okay, right? මේ පැත්තේ කැඩිලා, right? And there's another process that is actually broken. I'll show you in the software. It's like pointy, like a needle. Okay, it's very easy to break. එකයි කැඩලා තියෙන්නේ, right? It's called the styloid process. Stylus එකක් කියලා කියන්නේ something pointy. That is also to do what? Muscle attachment, right? So those are the parts of the temporal bone. Temporal bone has three processes. One is this zygomatic process, right? Other one is mastoid, and the other one is styloid. Both are for what? Muscle attachment. Take this down. Three processes of the temporal bone. So with that, we come to the end of the skull. Before moving on, I'll show you some of the things I couldn't show with the software. Okay, online people, do I need to send a photo? There's nothing on the board, right? IT is the ice දෙකක් එන්නේ, right? Okay, so what are the three processes of the temporal bone? Zygomatic process, mastoid and styloid. right? Right. So let's see one last time for the skull. Skull is actually a much, I mean, there's so many things to study about the skull, but in your case, you are studying only the bones and few of the interesting points, such as the sinuses and the fontanelles and the muscle attachments. Those are the basics, right? Our skull, I mean, anatomically, it has evolved to accommodate so many structures. If you think about it, I mean, of our five sensory sensations, four are located in our skull, right? Sight, hearing, vision, sorry, vision, sight, hearing, smell, and taste. Everything in this limited space, right? So, skull accommodates the structures necessary for those sensations, our eyes, our olfactory or the nasal, I mean, smelling organs, and our ears, right? And our tongue is located within the oral cavity, right? And all those sensory organs have a nerve supply, right? Those nerves are part of what we call as our cranial nerves, right? That are directly coming to the brain. We have two types of nerves as cranial nerves and spinal nerves. How many cranial nerves do we have? Do you have? You need to know that number. 12. 12 cranial nerves. එකේ ඉඳලා 12 වෙනකන් cranial nerves තියෙනවා. Right? In your skull, there are small holes. Ignore this big one. Foramen magnum is the only foramen that you need to know. There are so many other holes in the skull through which different nerves are going. Right? So each of those open foramens have to be described, right? So in medicine, in our exams, in the on the table we have a skull, right? So they ask us to pick up the skull and describe all the foramens that you have. උඩ ඉඳලා පල්ලෙහාට පිළිවෙලට කියාගෙන යන්න. Right? So you have to keep your sort of, I mean, කලබල වෙන්නේ නැතුව there's a set of rules that you have to follow. Angle and point කරන්න බෑ. You have to take a pencil and point, right? ඒ වගේ there are some ethics and there are bit of a procedure is there, right? So a skull has so many things that you can study about, but we touch only some of the basics, right? So for one last time with the software, I'll show you the skull, particularly the things I couldn't show earlier. Alright. The fontanelles. Let's talk about the fontanelles. Chutta. So, wait. Well, people, hold on. It's getting brighter. So this is a baby's skull, not an adult skull. How can you say that? Because of these, what? Tel walaval, fontanelles, right? Can you see the difference between the adult skull and the baby skull, right? There's no gap, right? That is the biggest fontanelle, that is called the anterior fontanelle. බබාලාගේ මෙතන අල්ලුවම අහුවෙන්නේ soft area එක කඩිය ඔබන්න එපා කියන, right? But the fontanelles we actually use in clinics when mothers come with the babies. We actually touch it and see if the closing of the fontanelle is according to their age. Because සාමාන්‍ය අවුරුද්ද පැනලා නම් ඒක ගොඩක් පොඩි වෙලා තියෙනවා, almost not there. So if the baby is still having fontanelles after about 1 year, that means what? Maybe the baby's nutrition deficiency or malnutrition, calcium මදි හරි මොකක් හරි, there could be some development problem, right? අපිට fontanelle එක අල්ලලා එහෙම හිතන්නත් පුළුවන්. Okay. So this is the front fontanelle, anterior fontanelle. This is the posterior fontanelle, right? උඩින් බැලුවා මෙහෙමයි. On the sides also you have this fontanelle called sphenoidal fontanelle, right? So all these help for the skull to compress, right? චූටි කරනවා skull එක චුට්ටක්. So the baby's head can come out a bit more easily, right? A bit more easy. Right. Going to the software again. What do I have to show you? I have to show you bit of the mandible again, right? Mandible. Hmm. So this is how we bite, right? Can you see if we remove this muscle, and can you see this massive muscle? Tadi muscle laga. Can you see where it is connected? Let's remove this one. Can you see this big muscle? Where is it connected? What is that process? Yes, what's the process? Coronoid process, ne? Mandible lege coronoid process එක නේ උඩ පල්ලේ. Right? So there's a big muscle here. හපද්දි මෙහෙම තද වෙනව තේරෙනවනේ. Temporalis. මේ පැත්ත. Right? It's called the temporalis muscle. It's a massive muscle, right? So that muscle is attached to your coronoid process. And you can see this is what? The condyloid process, that is articulating with the temporal bone. Yes. And then Mega, I want to show you this one. Can you see this ulavage part? Anyone know what this is? This pointy one. This one, this pointy. It's one of the processes of the temporal bone of the online. What is this process? Online people, what is this pointy one? Anyone? Hmm. Online people, what's this pointy one? Part of the temporal bone. Styloid process, ne? It's the styloid process. මේ තියෙන්නේ mastoid process. This is the mastoid process of the temporal bone. This is the styloid process. Okay. What else? Then this is the zygomatic arch. This is the zygomatic process. මේ තියෙන zygomatic arch එකේ temporal bone එක side එකෙන් එන part එක. That is zygomatic process. Alright. Okay. Let's go do some questions. Right. In the tute we have questions. Yes. This question, which of the following processes are present in the temporal bone of man? Quickly try. Online people, send me the answer. Question number 30 in the tute, which of the following processes are present in the temporal bone of man? What's the answer? Second. Okay. This side. Online people. What's the answer? Doide, nani? Ah, two. Answers are there. Right. What's the question again? Which of the following processes are present in the temporal bone of man? So you can see, right? කෙලින්ම gediya පිටින් MCQ සහනවා, right? From the support and movement and from the skull and from the temporal bone, right? Okay. 50 එක ලකුණක්. Out of 100, 1 mark. Mastoid process and the coronoid process. Coronoid is part of what bone? Mandible. Coronoid. Muscle attachment. In front of it, right? Coronoid process is found where? Mandible. Huh? Right? Styloid process and the mastoid, yes. What are the functions? Styloid and mastoid? Muscle attachment. Right in front? Muscle attachment. Styloid and mastoid provide surface for muscle attachment or just muscle attachment. Fourth one, mastoid and condyloid. Condyloid process, what's the function? What is the function of the condyloid process? In front of it, write down. In front of it, write down. Articulates with the temporal bone. Articulates with the temporal bone. Articulates with the temporal bone to form the temporal mandibular joint. ඒක නිකන් පොඩ්ඩක් චීට් කරන්න පුළුවන් නේ නිකන් අල්ලලා බලලා මෙතන මොකක්ද තියෙන ජොයින්ට් එක කියලා මැන්ඩිබල් එක එහෙම අල්ලලා බලලා මෙතන මේක ටෙම්පොරල් බෝන් නා එහෙනම් ටෙම්පොරල් මැන්ඩිබියුලර් ජොයින්ට් නේද right you can use your own body as your cheat sheet right ඇත්තට supported movement වල for example your forearm එකේම study කරද්දී and number of phalanges එහෙම අමතක වුණොත් ගණන් කරලා ගන්න right? Number of bones in your fingers how many what happens to your forearm එහෙම කරද්දී supination pronation කරද්දී මෙහෙම cross වෙනවා bones you can just count all the bones in your body අමතක වුණොත් upper limb එකේ bones ගන්න අමතක වුණොත් you can count right okay so next final statement coronoid and condyloid again coronoid is part of the mandible no? Sorry coronoid and condyloid are both part of the mandible right both part of the mandible right then there's another question number 30 බලන්න මේ page එකේ යටම in the human skull what I'm trying to tell you here is can you see in 2 years question number 30 MCQ number 30 has been what? From the skull I mean from support and movement yes from the skull itself right try to do it in this human skull that page last question question number 30 කියලා තියෙන 30 ගොඩක් තියෙනවා දෙකක් තියෙනවා send me the answer quickly 5. Is it that? 5. Okay. That's answer number T. 4 in 5 in 5. Okay, let's discuss. Um, in the human skull, vomer contributes to the cranium. No, vomer is part of the facial skeleton, actually nasal cavity ke gala, right? Part of the nasal septum, right? Nahaya left right වල divide කරන bone එකක්. Ethmoid and sphenoid are facial bones? No, they are cranial bones. In front of it, they are cut the facial and correct it. Those are cranial bones. Third one, zygomatic and parietal bones contribute to form the zygomatic arch. Yes, cut the parietal and correct it. It's a temporal bone. Ne? Mastoid process of mandible articulates with temporal bone. Mastoid process of the mandible. Condyloid process. පේනවනේ දෙක කන්ෆියුස් කරන්න හදන්නේ. mastoid process එක කොහෙද තියෙන්නේ? temporal bone එකේ. right? ඒතකොට එයාගෙම එකක් එයාත් එක්කම articulate වෙන්න බෑ. Maxillary and frontal bones contain sinuses. Yes. What other bones? Ethmoid, sphenoid. I couldn't show you the sinuses, no? Yeah. I'll show you next time. They all open into the nasal cavity. So nasal cavity again, infections එන්න පුළුවන්. That's how you get sinusitis. Have you ever had a headache? අර මෙහෙම ඉස්සරහට නැවෙන්න බැරි headache එකක් තිබිලා තියෙනවද? Ever had? ඔළුව ඇතුලේ නිකන් fluid. ඇත්තටම you will feel that there's a fluid that is coming forward in your forehead. Never had. Right? You can't bend එහෙම downwards and upwards. You are going to get a headache, nausea again. That's if you're having sinusitis. මේක අපි කියන්නේ සෙම පිරලා කියලා. It's actually yes, there is pus and inflammation or a mucous membrane එක completely inflamed and dead cells, dead bacteria, it's filled inside. So there's going to be pressure, increased pressure there. So it's painful, right? It's painful. You have to have sometimes IV antibiotics, oral antibiotics සමහරවට respond කරන්නේ නැහැ. You have to take IV antibiotics, right? Right. I think those are the questions that we have, past papers. I think there are some structured essay you can do as homework, right? There's one function of each of those in the human skull killer in the last structured essay. State one function of fontanelle, one function of the sutures, right? You can complete those as homework, right? Okay, moving on, page number 74, we can come to the vertebral column. We are still in the axial skeleton, right? We have to speed up a bit, right? Vertebral column. Let's read about it a little bit. It's a strong flexible rod consisting of 26, highlight the number, 26 linearly arranged bones, 24 separate vertebrae extending downwards from the occipital bone. So what is the starting point of your vertebral column? At the bottom of the occipital bone, skull එකේ යට. The sacrum, so 24 separate vertebrae, and at the very bottom you have the sacrum, and there's a chuti one called the coccyx. The vertebral column is divided into different regions. There are 4 distinct regions as a cervical, thoracic, lumbar, and the sacrum. Right? Highlight those names. Cervical region, vertebral column. It's very, very interesting. It gives us many of our human features, our main upright nature, right? even though we say we are upright, we are very bendy, we are very curved, right? We have our vertebral column or the backbone is not so very straight. Even if it was straight, we might not have had such a strong back. There are people who can deadlift 500 kilos more than like with their back, right? That strength and our ability to actually like Eliam Beluham, we are straight, right? That actual linear nature actually comes from all the curvatures, right? Kelimati both, it's going to be sort of mechanically disadvantageous. Vertebral column has 4 regions. This is the cervical region, our neck. Cervical region has 7 cervical vertebrae. Up to here, this is called what? Yes, thorax. It has 12. Up to here, this is the lumbar. There's only 5. This is the sacral region. It's only 1 bone, but actually 5 fused. අපි එක එකක් විදිහට ගත්තට rudimentary 5ක් fuse වෙලා තමයි හදලා තියෙන්නේ. I don't have a sacrum today, right? I couldn't find one. කවුරු හරි හොරකම් කරලා. These are not mine, right? These are public property. But අපේ medical faculty in the hostel we have like a collection of bones. I couldn't find a sacrum, right? This is a private. The white bones are private ones. This not so good ones are the public bones, right? Public පොත් වගේ ඒවා නිකන් use කළා they have gotten damaged, right? So these are the regions. Altogether we have how many? 24, and there's a chuti one at the end, coccyx. So it is actually composed of 4 fused. So altogether 26 separate bones. 26 separate bones form your vertebral column. Okay. So megam api kata karamu these all these bends, right? So curvatures of the vertebral column. This is a very commonly asked short note, right, in your exam, right? Curvatures of the vertebral column and also rich source of MCQs. Rich source of MCQs, these curvatures. In humans, there are 4 curves such as the cervical, thoracic, lumbar, sacral. They can be categorized into 2 main types as primary and secondary. So when you are a baby, we are in what we call as the fetal position. We are in fetal position, right? With our head like this, right? The babies like this, no? So the vertebral column is like this, curved. There's only one curve. In a baby, there's only one curve. What is one curve? That is the curve he is born with. This kind of curve, how we describe it? So this is our front side, right? These are behind. So if the curve is forwards, we call it concave anteriorly. This is the anterior side, no? Isarha. This is the posterior. This is concave, no? You know about these lenses and mirrors or concave nature, right? So this is concave Israhim Balut anterior, right? So this is what we are born with. So we say curvatures that are concave. So this is a human standing upright. This is his front, no? This is his back. Anterior, posterior. So these are curves. Can you see in this thoracic region and the sacral region you have anteriorly concave curvatures. Those are coming from our days as a newborn. අපි ඉපදෙනකොට තිබ්බේ මේ මේක curvature එකයි. Right? As an adult, we retain in two places that primary curvature. Right? බබා චූටි බබා කාලේ තිබ්බ curves දෙක we still have in two places. Those two places are what? Thoracic region and the sacral region. Okay? In the thoracic region and the sacral region, we have the same curve that we had when we were a baby. Right? So, read, in the fetus, there is only one curvature in the vertebral column. When secondary curvatures are formed, primary curvature is retained only in the thoracic and the sacral regions, which are known as primary curvatures. Right? So, I'm going to put thoracic is primary, sacral is also primary. Secondary curvatures are formed after birth. The first secondary curvature to develop is the cervical. 3 months of birth. Right? After about 3 months of age, Baba ipadila 3 months willing, we are going to get the first secondary curvature. Very, very important to remember. දැන් ඔයගොල්ලෝ newborns ලා හොඳට බලන්න යන newborns ලා, right? Very interesting. Newborns when they were born වඩා ගන්නකොට චුටි බබෙක් වඩා ගන්නකොට මොකද කියන්නේ? ඔළුව support කරලා වඩා ගන්න කියනවානේ. මෙහෙම නිකන් ඔහොම normal පොඩි කොහොම උස්සනවා වගේ ඔහොම උස්සන්නේ නැහැනේ shoulder එකකින්, right? එහෙම ඔළුව support කරලානේ වඩා ගන්න මෙහෙමනේ අල්ලන්නේ. Why is that? Because he can't support his head. One thing is because that his neck is not strong, muscles strong madi, and the other thing is his neck is not developed enough with this cervical curvature. මේ cervical curvature එක නැතුව you can't hold your head upright. මෙහෙම ගාලා floppy වෙනවා. head ඔළුව පස්සට වැටෙනවා. Right? So බබාලා have you seen මෙහෙම බඩ උඩින් තිබ්බහම බබාලා ඔළුව උස්සලාම බලනවා after some time. Right? බබාලා බඩ උඩින් තිබ්බහම කොහේ හරි ඇඳ උඩින් වගේ ඔහොම ඔළුව උස්සලා බලන්න. That happens after 3 months of age. That is because why? After 3 months, they have the cervical secondary curvature. That helps them to hold their head upright. 3 months of age. Then the next curvature to come is the lumbar curvature at around 7 to 8 months. මේ මොකද්ද මේ කාලෙට කියන්නේ? බබා හිට ගන්න කාලේ නේ. ඔයා හිට ගන්නවා කියලා කියන්නේ එක එකව අල්ලගෙන අර කොට් එකේ මේක අල්ලගෙන කොට් එකේ හිටගෙන ඉන්න එක පාටම එනකොට, right? They are standing up suddenly. That's because why? Their lumbar curvature has developed. So what is the second secondary lumbar curvature? Sorry, second secondary curvature. Sorry, second secondary curvature is the lumbar curvature, right? So if you take secondary curvatures, first one to develop is this. Second one to develop is this. Lumbar. Thoracic and sacral regions you still retain the primary curvature. Quickly draw this. Always they are going to question. These are what? These primary curvatures are what? They are concave. Concave anteriorly. Secondary curvatures are what? Convex anteriorly. May convexity. Right? Anterior side එකේ ඉඳලා බැලුවොත් you see them as convex. It's blurry. Am I blurry? Is there audio lag? Is there a lag or is it blurry? Quality dropped. There's nothing much. I used massive handwriting. Which source of MCQs, huh? Curvatures without. Let's in another 15 minutes. Let's take a break. Huh? Plenty can be late. It's lagging and blurry. Others, you are facing similar issues. Anyone else? Okay, done. So next up is a bit of a again essay rich area is asking you to describe vertebrae, right? So here I have several. The thing is, this vertebral column from here at the very top where the occipital bone is connected until the end, till the coccyx, we don't think about the coccyx, okay, until the end of this lumbar region, we have how many? 24 vertebrae, separate 24 vertebrae. All those undergo so many changes when you come down from the top to the bottom. එකක්වත් එක වගේ නෑ. Right? So many changes, right? But before, I mean, even though there are changes, we can describe a vertebrae as a typical one. සාමාන්‍යයෙන් vertebrae එකට තියෙන්න ඕන features ටිකක් තියෙනවා. There are some common features, right? So we can take what we call as නිකන් අර abnormal නැති එක. There are some vertebrae that we call as atypical. For example, this one is an atypical one, right? You will be able to understand. This is also a bit of an atypical one. This is also a bit of an atypical one. I'll send this around, right? It's also a bit of an atypical one. We are going to ignore those kind of atypical ones and we are going to focus on someone that is bit normal. What about this one? No. I think this is the best typical one that we have. Right? Get some pieces on the sides are broken. This is also a good one. Ah, yes, this one is good. Right? Okay. Usually we say the most typical ones. So what is the orientation? Make a vertebral column එක ඔය කොයි පැත්තට තියෙනවද this bone. This one. Which side is inside your body, which side is to the outside? This side. මේ pointy structures තියෙන එළියට. Because if you touch a vertebral column, you will be able to touch this one particularly. This is called the spinous process. Right? This is pointing outwards. Right? So this is facing inside your body. Right? So මෙහෙම උඩට පල්ලෙහාට there are vertebrae. Right? So this one is actually a lumbar vertebra. We say the vertebrae in our lumbar region, there's 5, no? Those are the most normal looking ones, right? We call them typical vertebrae, right? So we can describe vertebrae by describing a lumbar vertebra. නිකන් තේරුණාද? ඒ කියන්නේ සාමාන්‍යයෙන් vertebrae එකක් වෙන්න ඕනේ like a lumbar one. Lumbar එක කියනවා හැනම chill, natural, normal, right? Particularly when you come to the cervical region, there are so many abnormal shapes. But in this lumbar region, the lumbar 5, and most of the thoracic ones are also like that, normal. They are what we call as typical, right? So before we go on to these different abnormal ones, then can you see the difference of these two, right? Vertebrae එකක් කියන්නත් බෑ වගේ, right? Before we come to describe these kind of weird ones, atypical ones, we have to describe the typical one, right? So let's describe typical vertebrae, which is usually a lumbar vertebrae. Come to the resource book, right? Very likely essay question. Structure of a typical vertebra. Okay, page number 75. I'll draw it first so I can describe it. A vertebra, right, has two parts, right? There's a vertebral body and what we call as the vertebral arch, right? It has two parts like this, and there's a central prominent part like this, and there's a opening here. This is basically the structure. Okay. Let's read. A lumbar vertebra can be considered as a typical vertebra. Okay, highlight. A lumbar vertebra is a typical vertebra. A lumbar vertebra is a typical vertebra. The typical vertebra consists of the body and the vertebral arch. There's a body and the vertebral arch. So this area is what we call as the slightly inaccurate. You have to be able to draw this. You have to be able to draw a typical vertebra. Here you have the opening. Okay. The body is the largest broad and flattened part of the vertebrae. Right? Highlighted. It's the largest broad and flattened part. Right? This is what we call as the vertebral body. This region. Right? This region is what we call as the vertebral body. The flattened surface of the body of the each vertebra articulates with the corresponding surface of the adjacent vertebra so that vertebrae are stacked together in the vertebral column. If I explain that, adjacent vertebra are arranged like this. These are not adjacent ones. Side difference again like this, right? So the bodies and bodies are sort of aligning together, right? If you stack more and more vertebra up and down like this, you get the vertebral column. So your weight is sort of held by weight of the body is held by the body. මේ body එකෙන් තමයි weight එක bear කරගෙන ඉන්නේ, right? So that's what they say. How the flattened surface of the body of each vertebra articulates with the corresponding surface of the adjacent vertebra so that the vertebrae are stacked together in the vertebral column. However, adjacent two vertebrae are not in direct contact with each other as there is a tough pad of cartilage called intervertebral disc between two vertebrae. That is important. We'll also talk about it because there's a sort of a injury that is called as slip disc. In your tooth, I have included a diagram of this intervertebral disc. Online people, check in your tubes this diagram. This one. Can you see? Then even can you imagine? Vertebrae were touching each other when you are bending forward. Your vertebral column is very mobile. No, now you can do so many movements, right? So when you are doing such flexible movements, imagine your vertebral bodies, bone gavin, they are going to get worn down, given over. To prevent that, we have this tough pad of cartilage that is called what? Intervertebral disc. It is composed of mainly cartilage. මැද පොඩි gel එකක් වගේ එකක් තියෙනවා. Right? It has a core of like a gelatinous material surrounded by a ring of cartilage. Okay? It is called the intervertebral disc. Right? So keep in mind, yes, bodies of vertebrae are stacked in a sort of a straight line, but they are not in contact. They are not in contact because in between the vertebral bodies, what do you have? Intervertebral disc. Highlight the word intervertebral disc. There's a tough pad of cartilage called intervertebral disc. The size of the body of the vertebra increases downwards of the vertebral column to support the body weight. This is obvious, no? Right? The amount of weight that has to be borne by the vertebral column increases. Here, it's only the head. When it comes to here, you have to bear the body of the chest and the arms. Here, the abdomen itself, right? So the weight the vertebral column has to bear increases downwards. So the vertebral body has to increase in size. So can you see, compared to this vertebral body, this vertebral body is bigger, no? That means what? It's a lower one, no? මෙයාට වඩා පල්ලෙහා ඉන්න කෙනෙක් වෙන්න. Definitely someone below him. Can you see the difference in the vertebral bodies? Right? These are what you can consider as typical, right? You can touch and see. I'll keep this one to teach. Pass this. Those are probably lumbar ones, right? Lumbar. Okay. Next paragraph. Then we are done talking about the vertebral body. Then talking about the vertebral arch. Vertebral arch encloses vertebral foramen. This one. This is called vertebral foramen. So any guesses what goes through this? Make a through යන්නේ කවුද? Spinal cord. Spinal cord goes through the vertebral foramen. Can you see this empty में हिलක් තියෙන? Right? I can see you through it. Right? This is the vertebral foramen through which the spinal cord goes through. Then processes arising from the vertebral arch, right? Correct it. It's not the neural arch, it's the vertebral cord. Sorry, vertebral arch. Provides surface for muscle attached. Right. Then we have to talk about processes. Our back has so many muscle groups. I'll show you with the software. It's very complicated. We have so many muscle groups that help us to bend down sideways, backwards, forwards, lift weight, right? So many muscles are there. All those muscles are attached to different parts of the vertebrae itself. These two side pointy parts, right? They are called the lateral process, right? I mean, they are lateral processes. We call them what? The two transverse processes. Transverse process. This is also a transverse process. This is what? Vertebral foramen. Then there's another one. So you have to think of this in a 3D way. Think of it in a 3D way. So what are these? These are the two transverse processes, right? These are the two transverse processes. And is the what is this process pointing downwards? That process is again there is for muscle attachment, that is called the spinous process. ඒක තමයි මෙහෙම back එකේ අපිට අහුවෙන්නේ spinous process එක. If it's someone very very thin, you can clearly see their spinous process. Body fat තියෙනවා නම් it's somewhat covered, right? Spinous process. And the posterior process is called the spinous process. Highlight those words. The two lateral processes are called the transverse process, and the posterior process is called the spinous process. Highlight those two. Then you have to articulate with the above vertebra and the below vertebra. I told you your vertebrae can move relative to each other. Right? මෙහෙම චුට්ට චුට්ට relatively move වෙන්න පුළුවන්. පැත්තට පැත්තට මෙහෙම as a whole to the side. So to contact, so the bodies are separated by what? The intervertebral disc. But on the upper and the lower surfaces of the vertebrae, there are two contact points that the upper and the lower vertebrae are actually in very sort of fitting into each other. They are fit වෙලා තියෙන ලස්සනට building blocks, right? So that you can have the curvatures, right? So imagine this vertebrae is here, right? So there's a vertebra above and vertebra below. So to articulate with the vertebra above, this one has what we call as superior articular process, right? So උඩින් තියෙන්නේ, right? I'll draw it like in the resource, right? You can draw them like this. This is called the superior articular process. What is the purpose of that? To articulate with the above one. උඩ එක්කෙනත් එක්ක, right? Is it raining? That's why the signal is dropping. Superior articular process, right? Then label this as a whole, right? The two main parts, right? This part is what? Body. From here, this whole thing is what? Yes, vertebral arch. Quickly draw a rough diagram. This is the same one in your resource. Just sort of to memorize it, right? So send your questions to the main chat. Yeah, the spinal cord curves. මෙහෙම curve වෙලා යන්නේ spinal cord. Because the foramens are in a curved path. Because the vertebrae are curved, the vertebral foramens are curved. So the vertebral column is curved. Okay. So after that, you can take a small break, right? Once you have drawn this, take a small break to take a, right? Then we can finish talking about the vertebral column and appendicular skeleton. Then that chunk is over. So you have to be strategic, okay? So you have to cover the syllabus on the hari naraking hari. Okay? Theory class if it's going slowly, you have to cover it from here and there because it's like it's not O levels or එම lesson පිළිවෙලට ලස්සන්ට syllabus එක cover කරනවා කියලා එකක් නැහැ, right? Somehow at the end of the day you are going to go to the exam alone, so the 25 people are done. Chemistry part 2 was held today, right? So they are done officially. You are up, right? There is no above batch, right? You are the next batch, right? 25 people are officially done with the exam today. Not officially thing are English general knowledge අරම ඒවා තියෙනවා, right? Chemistry part 2 was held today. You just go through the bio paper. You know bio paper. Yes. MCQ is hard, no? Yes. MCQ paper is hard. We don't know about the structured essays. We were able to guess. A lot of the essays were guessed. 4 of the 6, maybe 4 out of, I mean 5 out of 6 almost, we predicted. So you can't say that was difficult, but MCQs were actually somewhat tough, right? Go home and check. I'll be having a 25 paper discussion session as well, right? Special online one. Those are fitting, no? Yeah. These are adjacent ones. Nice. Right. Not exactly. මැද එක්කෙනෙක් missing වගේ. No, could be. Could be. Can you see? What is missing here? Remember, bodies, they are not touching. Intervertebral discs are there. Right? Online people. Can you see? They are not supposed to be touching like this. Right? The bodies are supposed to be separated by the cartilaginous intervertebral discs. Right? On the sides, you have what? Transverse processes, and pointing downwards, you have spinous processes. Right? These are for the back muscles attachment. Right? And you can see, can you see? These are the inferior articular process. So we make a superior articular process. So these are the superior articular processes of the below one. So they are in contact with the inferior articular process of the above one. Right? මෙතෙන්ට එහෙම set. Right? Got it? Okay. Take a 10-minute break. Right? Quick break, and online people also 10 minutes. Come back. People, can you hear me? Right. You can hear me, right? Yeah. Okay. So we are done with the typical vertebra. No? I'll show you the other atypical ones. Right. It's important that you have an idea about how they all fit in sort of the 3D view. Right. This is okay, ne? Right? You have to be able to draw this. In an essay asking you to describe a typical vertebra, which is a very likely one. සාමාන්‍යයෙන් atypical ඒවා අහන්නෙත් නැහැ. Separately, you won't be asked to describe a thoracic one, or sometimes you can thoracic, but the most common area, I mean, the topic that you can be questioned is to describe what a typical vertebra, which is what a lumbar vertebra. All right. So now that we have talked about what a normal vertebra looks like and how they all behave, let's see the abnormal ones and also their specific roles. There are specific roles in this, the sort of functional unit that is the vertebral column. Now, people, can you see? Right. So this is how the vertebral column and the curvatures you can see, right? I have in the cover page outside, I have included this sort of exact same diagram in the tute, right? It is your responsibility to the label it. You can, I think you can count individually. Yeah, the 7 cervical, can you count? 12 thoracic, I think you can count. නේද? So අර විදියට මෙහෙම අර that සංගල වරහනද මොකක්ද එක දාලා label them as cervical, thoracic, lumbar and the sacrum, right? Okay, in the outer cover. All right. Okay, let's zoom in to see how these are arranged. So you can see how, right? So this is vertebra number 1. Okay, we call it because it's cervical 1. අපි ඒකට නම් දෙනවා cervical C, C1, C1, C2, C3, C4 ඔහම යනවා up to where C5. Okay, so that is the end of, sorry, C7. C7, that is the end of the cervical region. You can see, right? Then we start the thoracic region. So it is concave anterior. T1 එකේ ඉඳලා, all right, so this is T1, this is T6, so this is T11 and T12, right? The end of the thoracic region, right? Then we start the lumbar region, L1, L1 indala, this is L4, L5. So that is the end of the individual vertebrae. Then we have the big sacrum, right? This sacrum we have to talk about, right? Can you see it is also concave anteriorly, right? Concave anteriorly, it's one of the part of the primary curvatures. It's part of the primary curvatures, right? It's like this. So if we take one of these lumbar vertebrae individually, what are the things you can see? What is this green color part? That is a vertebral body. What is this empty hole? That is a vertebral foramen, right? What are these two side processes? What is this? It's one of the transverse processes. This is the other transverse process. And this one is the spinous process, right? You can see this is one of the, I think, this is the, yeah, so this is the superior articular process. It is this orange one is the inferior articular process, right? So this is what, this is a lumbar vertebrae. This is what we consider as a typical one. So let's move on to the atypicals. Out of the atypicals, let's start with the very first one. Right? Zooming in, zooming in, zooming in to the very base of the skull. We have in contact with what bone? What is this bone at the bottom of the skull? Occipital bone, right? This is the blue one, occipital bone, right? In contact with the occipital bone, you are able to see the occipital, foramen magnum. This is called atlas. Atlas can I call? It's like a mythology. He's, what is he doing? He's holding the weight of the world, no? Holding the sky. Sky is on his back. So, or the world, or the universe, Earth, Earth, right? So, in our body, we are analoging the skull to the earth, and who is holding the skull up? Atlas vertebrae. So this is atlas. It's a very, very specialized atypical vertebra, and it is in sort of close contact with the second one, C2, that is called axis, right? Atlas and axis are in close contact, maybe, right? Can you see? Maybe sideways below. This is the only bone support to our neck. Can you see? The only bone support to our neck, very small, right? So let's talk about Atlas, right? Then we can talk about his close friend Axis also, right? Let's zoom in on Atlas. It's like a ring, right? Vertebrae ka නෙවෙයි වගේ, right? It's not like a vertebrae at all. It's mainly like a ring because why is it so? Why is it having such a big? What is that hole? It's a vertebral foramen. No? It's a vertebral foramen. Why is it so big there? It's because the spinal cord is the biggest at the top. So if I add the spinal cord to this, right? If I add the spinal cord and I remove the cartilages, can you see the spinal cord, the big one? The spinal cord is biggest when it is closest to the head. The spinal cord becomes gradually smaller and smaller and smaller in size when you go down the vertebral column, because why? Nerves are going out of it, right? At the end, it's very small. I mean, not very small, it is comparatively. If I remove all the bones, can you see the change in thickness of the spinal cord? This yellow one is a spinal cord, the thick. All these others are nerves coming out of the spinal cord, right? Can you see it's becoming more than its sort of width, it's becoming thin, right? Can you see it's very thick up here? That is why at the very base of the skull or the base of the brain, your first vertebra has to be having a very wide vertebral foramen to allow passage for the thick upper part of the spinal cord. Okay, so that is the atlas. Then immediately below him we have atlas ke parts ටිකකුත් බලමු. On the two sides, atlas also has some transverse processes, but they're chuti, right? Very, very small. Okay. And the interesting thing about this atlas and also the other cervical vertebrae is that their transverse processes have a hole like this. They have a hole like this. This hole is there to allow the passage for a blood vessel. That blood vessel is called the vertebral artery. Vertebral artery is one of the blood supplies to the brain, right? If I show you this vertebral artery, can you see? So these are the cervical vertebrae. අපි යටින් බැලුවොත් in this cervical vertebrae, can you see all of them are having holes in their transverse process? But if you look at one of these thoracic ones, are they having holes? No, right? But these cervical vertebrae are having holes, right? So if we include the blood circulatory system into this, and can you see there's a blood vessel going through those, no? Well, people, can you see? Right? Can you see this blood vessel going through this foramens? Through the foramens in the transverse process of what? Cervical vertebrae. Anyone? What is this blood vessel called? It's going through this vertebrae. This is called the vertebral artery. Vertebral artery. Okay. That's why they have a foramen in the transverse processes. Okay, it's one of the unique features of cervical vertebrae, right? Then let's keep talking about these other cervical vertebrae. So we talked about first one, C1, no? Then let's talk about C2. So this is C1, C2, right? C2 is called axis. Axis is very, very special because of this green color upward projection. That is called odontoid process, right? Odontoid process. In your tubes, I have included diagrams of all these, okay? Atlas, axis, right? Highlight the parts, okay? This odontoid process is very, very special. If I come back to this view with atlas included, I think you might have noticed that this odontoid process is actually going inside the atlas, right? Here, can you see? How do we look at it? මෙහෙම පිටිපස්සෙන් බලමු. Can you see this odontoid process? Odontoid process is going inside the atlas. That is how, this is very, very interesting. That is how we turn our heads like this. Okay, that's how we turn our heads like this, side to side. Atlas sits on here. There's a fit for a place for this axis gate, upward projection fit in. So around that, our head can rotate. Side to side movements. Okay. I have atlas and axis, so you can try it, right? And they are kept in place. The මේක නිකන් මෙහෙම බැලුවාම you will see that මේක නිකන් you can slip out, right? There's actually a ligament. If I remove this පෙනේද? එකත් remove කරොත් පෙනේද? There's actually a group of ligaments, can you see? Holding the odontoid process close to the atlas. එහෙම slip වෙන්න දෙන්නේ නැහැ, because those are not bony structures we can't see in the dead body, right? That's how you turn your head side to side. දෙපැත්තට හැරවෙන්න ඔතන. Okay. So that is about it. Atlas and axis, those are the specialized cervical vertebrae, right? Moving downwards, let's talk a little bit about our thoracic vertebrae, right? In our chest area, the vertebrae that we have, right? Those are T1 to T12, right? These are very normal looking vertebrae, except they are in very close contact, and also they are in very let's say articulating with our ribs, right? The 12 thoracic vertebrae are articulating with our 12 ribs, right? දෙපැත්තේ එක පැත්තක 12 ගානේ we have 12 ribs, 12 pairs of ribs, altogether 24, right? So the 12 thoracic vertebrae are also articulating, or let's say moving with the 12 ribs. Because of that, they have an additional articular surface. Articular surface එක කියන්නේ මොකද? A surface that articulates with another bone, no? That moves with another bone. So our 12 thoracic vertebrae have articular surfaces to move with the ribs as well. These are the 12 ribs, right? So you can clearly see, right? අපිට thoracic 12 vertebrae දීලා තියෙන්නේ for the 12 ribs, right? So that is something, that's the only interesting thing about this thoracic vertebrae. Lumbar vertebrae, you know. And let's talk a little bit about the sacrum. You can see it is composed of 5 fixed vertebrae. එතන 1 2 3 4 5. Can you count? Holes 4යි තියෙන්නේ, but උඩ ඉඳලා 1 2 3 4 and the below one 1 5. It's composed of 5 fused ones. Why have we made one big bone by fusing 5 vertebrae? Why not have 5 separate ones? Would separate hitiyana? That is because at this point the body weight is very high, right? You have to bear entire upper body weight. So to bear that, it is better to have one big bone. හෙල්ලෙන්නේ නැති solid big bone එකක් තියෙන එක better than having movable individual bones. So what has happened in the sacrum is 5 vertebrae has fused වෙලා තියෙනවා to make one block big bone. So on the two sides of the sacrum, you have the pelvic bones, right? Pelvic bones කිව්වට they are actually composed of fused bones, right? ඒක ඔයගොල්ලන්ගේ to your level you don't need, just what you need to know is they are the two pelvic bones. And at the end of the sacrum, you have the coccyx, right? It's a remnant of a tail. It's a remnant of a tail, no exact function. Podi muscles ටිකක් මෙතෙන්ට attach වෙනවා to the coccyx, few muscles attached, but I mean, it's a reduced structure from a early tail. It's composed of how many fused vertebrae? Four. You can count. You can count, no? 1, 2, 3, 4. Right? ඔය ටික තමයි. Okay? Vertebral column. So we can go through the resource book and I'll pass around some of these atlas and axis. Right? Online people, any questions? You can clearly hear me, right? So, atlas and axis. Let's talk about. This is an axis. This is an axis. Okay. So, yeah, skull, occipital bone is on atlas. Right? Here, on the underside of the skull, that is on the occipital bone, you have two surfaces that we call as occipital condyles. Occipital condyles articulate with the articulating surface in the atlas. Maybe less than a smooth surface in the atlas. That is articulated with the occipital condyles located in the skull, occipital bone. So this atlas and the occipital condyles allow මෙහෙම nodding moves. This is called nodding moves. Yes, nodding again. Yes, yes, no, yeah, yes, again, yeah. Nodding movements. It is the joint in the nodding movements. It's the atlanto-occipital. Again, atlas again, atlanto again, right? Atlanto-occipital joint. You can nod between what are the surfaces? Occipital condyles on the skull, occipital bone, and then these two articulating surfaces on the atlas. So that is nodding. How do we now get from side to side? It's like this. Right? So this is upward within this axis of this odontoid process. Odontoid process. Okay? So atlas fits into here. And this atlas fits into here. And nod your head like this. Not more the something interesting about this is called atlantoaxial. Method again, atlantoaxial. Atlas axis. Atlantoaxial joint. Something interesting about this. Do you know of judicial hanging? Judicial hanging. What do you know about judicial hanging? Execution. At the law, we have, I mean, in Sri Lanka also, we have done it, right? Hanging as a form of execution. How do you do it? Hanging is a very complicated thing. Now, if a person commits suicide by hanging from the fan or somewhere, what is the killing thing? Usually there's a rope, and he's sort of he picks a chair underneath him, and he hangs. No? What is the cause of death? The rope is constricting blood vessels in the neck. Blood vessels are constricted. Blood vessels are there. So the brain doesn't get blood. So Dies with. That's how you usually die in suicide, right? In judicial, legal, so the judicial you've seen that sort of the it's called a noose. Noose and underneath the floor opens. Execution leave the floor, the two flaps open. So the person falls down like 20, 30 feet. That much. 20 feet. Right? So it's like there's a lot of force. And you can, it's not like you're kicking a chair and you're just hanging like this. Thrown down, yanked up. Long way, they the yank. So in that yanking immediate force, what's going to happen is this non-prime process is going to be this bone is going to. So how you are going to die in that sort of execution is because of your brain stem or the spinal cord is going to be torn. It's going to be yanked. The neck is going to be stretched. And the spinal cord is going to be torn. And it's a very quick death. Right? If you commit suicide, how are you going to die? By not having blood. It's going to take a lot of time. You are going to, I mean, so there's going to be a lot of pain. The brain is slowly dying, slowly dying. But in a judicial hanging, well, the spinal cord gets severe from loss of connection, right? So no blood to the brain, spinal cord completely disconnected, no pain sensation. And if you sort of do a post-mortem, what do you say, post-mortem to a person that was killed by a judicial hanging, you see that this odontoid process is fractured, right? Because it's a very small thing, right? They have another axis, huh? Yeah. Okay, we also treat them and see the axis fits together. How you sites. Okay. I haven't clicked on the mic. Online people, sorry about it. It was on lagging. Yeah, sorry about it. I had. Okay. Right. There's a question. Why can't we turn the head 360? Why is that? It's going to tear your brain neck structures, blood vessels, spinal cord, everything, nerves, right? Everything you can't turn. You can't turn 360. There are ligaments stabilizing the neck. That limits the movement, right? Which are maximum, right? Only people, do you want me to repeat everything, right? What I was saying is, in a judicial hanging, what happens is the floor, when you are doing an execution, the floor suddenly opens and the person falls down with the rope around their neck, right? About 20, 30 feet. That speed is going to yank your neck and it's going to tear your spinal cord and the brain stem. So the significant or the unique thing you will see in a person that was hanged by judicial, right, after as an execution, you will see that their odontic process is fractured. Okay. Is it lagging, audio lagging or video lagging? So, Now it's okay. Right. Okay. Okay. Right. Shall we come to the resource book? We have to highlight. Right. So we have talked about a typical vertebra. Then page number 76. Right. Region specific vertebral characteristics. Region specific. Huh? Cervical vertebrae. If you are talking about cervical vertebrae, they are the first 7 vertebrae in the cervical vertebral column. Then there's a list of special features. Okay. First one, cervical vertebrae are the smallest. Put number 1 there. They are the smallest. Body of the cervical vertebra is smaller compared to other vertebrae. I have another. These are the atlas axis can very very special level. I have some other cervical vertebra also. I think this is C6 or something. Okay. Still, where are the other vertebrae? Okay. Even compared to a thoracic one, can you see the difference in the vertebral body? This is a cervical one. This is a thoracic. Can you see the difference in the vertebral body size? Very small compared to others. Right? That is one difference. Highlight. Body is smaller compared to the others. Then, in addition, transverse process of a cervical vertebra have a foramen on each side for the to provide passage for the vertebral artery. Highlight. Put number 3 and highlight for the passage of the vertebral artery. Can you see these two holes on the two transverse processes? These are the transverse foramen processes for the what? Vertebral artery. Final difference, the spinous process of these most of these processes are bifid. What do you mean by bifid? මෙන්න මෙයාගේ හොඳට පේනවා. Bifid means the spinous process has these sort of two arms. Can you see? Spinous process එක මෙන්න පොඩි දෙකට බෙදිලා තියෙනවා. දැන් මෙයාගේ it's not that much but නිකන් චුට්ටක් බෙදිලා වගේ තියෙනවනේ චුට්ටක්. මෙයාගේ හොඳට. This is something like C3 or C4. Okay? You can see the vertebral foramen very prominent. පේනවද? For the vertebral artery. Right? So those are characteristics of cervical vertebrae. What are they? Their body is usually smaller. They have a foramen uh, on the two transverse processes. You didn't check on the two transverse processes for the passage of the vertebral artery. And usually their spinous processes are bifid. Spinous processes are bifid. So come to the end of the tute. Write down cervical vertebrae. Oh, next to the diagram, do you have space? Tute take a vertebral, sorry, cervical vertebrae. Do you have some space? No, I haven't given a typical. Yeah, I have. In the second page, there's some space on the side. Atlas and axis then in conjunction next to that diagram. Write down the special features of cervical vertebrae. First one, their body is small. They have a foramen on the transverse process for the vertebral artery. Third one, they have bifid. Bifid, vertebral artery, and smaller body. Right? These comparisons are very important. Okay, structure is a paper. Then There are some special features of the atlas. I have talked about, I just explained about the atlas. All right. What are the special features of atlas? Yes, there's a list. It's a ring shaped vertebra, no distinct body or spinous process. It's just a ring, no? There's no distinct body or spinous process. It has two short transverse process. Atlas contains two flattened facets for the articulation with occipital bone of the skull, permitting nodding movement. Write down no body. What else? What does it have? No spinous process. What else? Ring shape. If they ask you to describe, you have to write down, right? Then two facets for articulation with what? Occipital condyles. Where do you have the occipital condyles? Occipital bone. Okay. So what does it allow? Why are we having this joint? For the nodding movements. What do you mean by nodding? Exam එකේ nodding කියන්නේ මොකක්ද මතක? Backward and forward. And also, vertebral foramen is usually larger, right? Usually we say, you can say largest vertebral foramen එක තියෙන්නේ කාටද? To the atlas. Largest vertebral foramen also found in atlas. Write down these points, huh? Right? Still connection issue. It's raining here, that's why I think. Online people, any questions? Okay, atlas. Moving on to axis. What is the most unique thing about axis? Odontoid. Huh? It's a superior projection called odontoid. What is so special about odontoid process? The head pivots. Pivot එකක් කියලා කියන්නේ මෙහෙම. There's a projection like this and something is fitting into that. So what that thing can rotate on this direction or that direction. This way. The head pivots on this joint. Okay. What's the first point of the cervical vertebrae? Small body, no? What does it say? Body of the cervical vertebra smallest. That was the first point. Yes. If you like, you can write down. This is called atlantoaxial. Between atlas and axis, it's called atlantoaxial joint. Axis and atlas. Method of belly movement sticker, now you know, right? Is it happening in the same place? No. Nodding bit above, directly skull and atlas, side to side, or the pivot between atlas and axis, right? See how you get the neck sort of mobility, not the same joint, no, right? Right. Shall we move on to some thoracic vertebrae? As I told you, the only special thing about thoracic vertebrae is that they are close friendship with the ribs. Okay. Right. They are usually compared to cervical. Thoracic vertebrae have larger body. Okay, this is obvious. No, pallet body size you have to increase, right? Then the important thing is they have facet for articulation with ribs. Facet for articulation with ribs. So for now, I'll just quickly show you. This is a thoracic vertebra. If you take a rib, this is a sort of a typical rib. It's a flat bone, right? This is the direction. So this is the front of the body. So the rib usually fits like this to the side of the body as well as to the transverse process. May fit. Imagine you have 12 ribs like this, and the ribs are usually pointing downwards. Okay, ribs are usually pointing downwards. When you are breathing in, what's going to happen? The ribs are moving him outwards and upwards. That's how you increase your thoracic volume. That's how you breathe in, right? Volume decreases and the pressure, sorry, volume increases and the pressure decreases. Oxygen or the air flows in. To do that, we need to have ribs moving like this. So, what is the relationship between thoracic vertebrae and the rib is like this? The rib is in contact with the body of the thoracic vertebrae and also the transverse process, right? Okay. Any questions? So let's read about it. Yeah, the body and the transverse process of the thoracic vertebrae have facets for articulation with the ribs. You will see there are some smooth areas in this body. You will see that there are some smooth areas in this body for the rib to fit in. Here, can you see one? Here, there's a smooth area, and on this transverse process, sorry, Gevich area there is for the rib to fit in. Okay. I only have one proper rib. All the ribs are broken. They are very easy to sort of take because they are very thin bones. Ribs are very, very thin bones. I have some rib fragments. Right? Some fragments of ribs. Ribs nikama kadnawane in any sort of accident, particularly not ribs kadenna puluwan. Right? They are very thin bones. Right? Thoracic vertebrae. Finally, lumbar vertebrae, page number 78. There's nothing more for us to learn about lumbar vertebrae because we have studied about typical vertebrae. They are the largest of the vertebrae because they have to support the weight of the upper body. They are also, their body is larger compared to other vertebrae, and they have large spinous processes. හැමදේම large කියලා මතක තියාගත්තා නම්. Okay, highlight those things. They are the largest, and the body is larger compared to others. And finally, they have large spinal processes. So, where are my other vertebrae? Where are the other vertebrae? This is also a thoracic one, no? Amit? Can you see? They are nikang heavy duty spinous processes. Can you see? They are very thick, no? Compared to this thin, long one, right? On the muscle strength එකක් බය නැතුව you can apply a lot of muscle strength here because large spinous process, right? So sacrum and coccyx highlight the things I have explained all, right? Triangular shaped large bone consists of five fused rudimentary vertebrae. Five fused මේ number එක අමතක වෙන්න පුළුවන්, right? It happened to me on a certain exam. Foramen හතරයිනේ තියෙන්නේ, right? Sacrum has four foramens. Openings හතරයි තියෙන්නේ. So පාටම ඔලුවට එනවා, is it only four? But it's five, okay? Five fused vertebrae. Concave anterior surface, upper part articulate with the fifth lumbar. උඩින් ඉන්නේ කවුද? Fifth lumbar. On each side you have the two pelvic bones. Right? It's always fixed right? Femurs in a minute. Yes, sir. No, wait. Symphysis pubis. Man. Yeah. Sacrum fits here. මෙතන මේ පිටිපස්සේ හිස් තැනක් තියෙන්නේ. This is the place where the sacrum fits here. Right? Sacrum is missing. Right? On the two sides. These are the two sort of contact points for the sacrum. Here the big sacrum is there to provide support. Right? So this is your pelvis. මෙතෙන්ට මොකද fit වෙන්නේ? So this hole will come there. Right? To this hole, what is fitting? Head of the femur. Like this. Right? This is the longest, strongest, heaviest bone in your body. Right? So that's the end of the vertebral column. Any questions? Any questions from the vertebral column? Online people? It's raining here. Do you have any connection issue? And also highlight in the resource about this vertebral foramina. Okay. A series of vertebral foramina present on each side for the passage of nerves about the sacrum. Highlight. Right. There are things that we call as sacral nerves. Sacral nerves come out of the foramina on the sacrum. Right. A openings තියෙන නිකන් හුලං වදිනවා වගේ නෙවෙයි. Right. For the nerves to go out. Okay. If you come to medicine, you will learn about the sacral nerves. Rather, there's a sacral complex. Most of the nerves going to your legs and also your pelvic organs, they originate from the sacrum region in the spinal cord. ඇත්තට මේ වෙනකොට spinal cord එක ඉවරයි. It's like the end of the spinal cord, right? And they go out of those openings. Okay. Right. Then there are some common functions of the vertebral column. Basic one is what? Put number one there. Erect posture. Erect posture is the fundamental requirement, right? Erect posture. Suppose the skull is number two. Articulation to ribs and girdles, right? What are the two types of girdles? Pectoral and pelvic. Vertebral foramens provide spaces for spinal nerves, blood vessels, lymph vessels, and the vertebral column allow flexibility in body movements. Intervertebral discs act as shock absorbers, right? Put numbers to all those. Okay. Vertebral column done. Let's do a question for the lesson rates. Like that's the policy, no? Right? Makari karo, we have to do a question. Um, I think there are several ones. Question number 46 කියලා තියෙන එක. The in between the two questions we did 30 දෙක මැද තියෙන්නේ 46 කියලා එකක්. Can you see? Online people, did you find it? In the human vertebral column, it's a ABCD type question. Send me all the possible correct answers. Huh? 1 minute. Okay. What's the answer? CND. Yeah, online people, CD, 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 CD. Okay. Right. In the human vertebral column, 24 bones are linearly arranged. How many bones are linearly arranged? 26. Right? Sacrum and coccyx, අමතක කරන්න බෑ. Right? Even though it's the vertebral column, they are part of the vertebral column. Okay. Cervical curvature develops around 7 to 8. No. Cervical curvature comes before. It's the first secondary curvature. 3 months. No. Thoracic region is formed by 12 vertebrae. Yes, there are 12 thoracic vertebrae. Cervical vertebrae contain foramen for vertebral arteries. Yes, vertebral artery. Where in the cervical vertebrae you have? In the transverse process. In the transverse process, there's a foramen. Lumbar vertebrae contain bifid? No. Where do you have bifid? Cervical. Right in front, cervical vertebrae. Okay. Then we can move on to the final part of the axial skeleton that we have to talk about. We are still in the axial skeleton, na? Right? Sternum and the ribs. Okay, sternum and the ribs. Sternum is an interesting bone. I don't have a sternum because the sternum is sort of, it's not very easy to preserve. Again, I looked everywhere, but there's no sternum to be found because it's not easy to preserve. It's igmentum. It gets sort of decomposed, right? It's very fragile. What do you know about the sternum? Sternum bone, any bone has what in the middle? Bone marrow is there. There are two types of bone marrow as red and yellow. Okay. Out of this, red bone marrow is very, very important because of what? Red bone marrow, it's the place of erythropoiesis, red blood cell production. Okay. Out of all the bones in the body, most of the red blood cell production occurs in our flat bones. Any bone that is flat. So here, what are the flat bones you can see? These are long bones. Long bones. මේ වගේ තියෙන්නේ yellow bone marrow. They don't make blood cells. If you take this one, pelvic bone, flat, no? Here, this part. So pelvis is a place of red blood cell production. Also in your skull, in your frontal bone also, there's red bone marrow that can make blood cells. Sternum is more than anything one of the important places of red blood cell production. Sternum is a nice bone like this, right? It has several parts, right? The upper part is called the manubrium, right? And it becomes slowly a bit narrow like this. At the end, you have a tip like this, right? Up to here, this is called the manubrium sterni or manubrium of the sternum. Sort of up to here, this is the body of the sternum. This cuticale or the tip of the sternum is called the xiphoid process. And here in this body of the sternum, you have sort of notches, නිකන් අර notch වෙලා වගේ පොඩි පොඩි indentations you have for the ribs to connect, right? So how is your thoracic cavity formed? පිටිපස්සෙන් thoracic vertebrae, on the sides ribs, in front sternum. That's how you get the full thoracic cage, right? All around structures, right? So this is the front structure. So the ribs have to connect anteriorly to the sternum. Okay, let's read about the sternum. Page number 78. Okay, page number 78. Sternum, long flat bone that forms the anterior part of the thoracic cage, right? What is the composition of the thoracic cage? What are the parts of the thoracic cage? You can write down. Posteriorly, thoracic vertebrae. Laterally, ribs. Anteriorly, sternum. Okay. Uppermost section of the sternum is the manubrium, which articulates with clavicles in the pectoral girdles and the first two pairs of ribs. This is a bit interesting, right? So this upper part of the sternum articulates with a bone called the clavicle. Clavicle is an interesting bone. Clavicle is symmetrical, right? Right. Clavicle. We have two clavicles. Yes, I have two clavicles, right? But what is a clavicle? collarbone. මෙතන තියෙන්නේ. Right? Clavicles මෙදෙන්නක නම් these are clavicles of, yeah, left and right. Yes, nice. These are left and right clavicles like this, right? So this side connects to the upper part of the, it's like this, no? Halal band, right? මෙතන තියෙන collarbone, right? You have the collarbones here. The two clavicles are like this. So this end of the clavicles connect with the manubrium of the sternum, and on the other side, on the other end, they actually connect to where? This is our shoulder blade. Shoulder blade. This is a, hold on, left. Put right shoulder blade, right here. Clavicle connect to here, right? It's called what? Scapula. Scapula. Shoulder blade එක කියලා කියන්නේ, right? So yeah, upper, right? Your hand, upper arm muscle, sorry, upper arm bone. It's called the humerus. Connects here, right? මෙහෙම තියෙන්නේ. Anatomical position. Okay. Clavicle connects to here. Clavicle connects to here. Got it? Scapula, clavicle. What is the other end of the clavicle articulating with? Manubrium of the sternum. Right? Manubrium which articulates with clavicles in the pectoral girdles and the first two pairs of ribs. Also, we have the first two pairs of ribs going like this. Right? මෙහෙම පස්සට යනවා. The first two pairs of ribs. There's a better diagram in your resource, right? First two pairs of ribs. Then the body of the sternum gives attachment to the rest of the ribs. Okay, the rest of the ribs are attached to the body of the sternum. Then the xiphoid process is the tip of the bone which gives attachment to the diaphragm and muscles of the anterior abdominal wall. What are your anterior abdominal wall muscles? Anterior means what? What is the type of muscle that comes to mind? The six pack, right? That is called rectus abdominis, right? I will show you in the software, right? It is running down like this, right? It is divided into sort of this sort of boxy sections, right? That muscle is attached to the xiphoid process here. And your respiratory diaphragm that is helping us to increase our thoracic volume, it is also attached like this diaphragm to the xiphoid process, right? I will show you this. Got it? So anterior abdominal wall muscles as well as the diaphragm is attached to the xiphoid. Okay. Then functions. Sternum provides protection to the organs and the blood vessels that lie behind it. What are the organs lying behind it? Here you have the two lungs, and also immediately behind it you have sort of half hidden, you have the heart, right? Direct trauma එකක්, direct punch එකක් කරේ, direct damage එකක් කරේ, body accident එකයි මොකක් කරේ එක, sternum will protect your soft important organs, right? Lungs and heart basically. And the red bone marrow of the sternum is one of the main sites for the red blood cell production. Highlight red bone marrow, right? I told you sternum is one of the most important sites for red blood cell production. Okay. So what are the things you know about the sternum now? I will finish that sternum discussion with the ribs, okay? Because sternum and the rib scale again they are very closely associated, right? So talking about ribs, how many ribs do we have? In total, එක පැත්තක 12 ගානේ we have straining, no? එක පැත්තක 12 ගානේ we have 12 pairs, 24 in total, right? We can classify these ribs according to how they are attached, okay? So anteriorly, if you take, what are the attachments? Sternum is the front attachment of the ribs. පිටිපස්සෙන් attach වෙලා ඉන්නේ to the thoracic vertebrae. So no issue about the behind. The question comes, what happens to them in the front? So these 12 we can classify as true vertebrae and floating. Actually, this is a side classification, right? True and false vertebrae කියලා you can classify, but this false word is not in your syllabus. Out of the false, you have another one called floating ribs. Okay, floating ribs. I'll show you this with the software. Okay, how we classify these is like this. වැඩේ තියෙන්නේ, at the front, our sternum is not long enough, right? At the front, our sternum is not long enough for all the ribs to attach. So that's why some of the ribs are left without any attachment. Right? Some of the ribs are left without any attachment. I'll show you. Online people, can you see? It's getting brighter. Right? So this is the sternum. Any question? No. Alright. This is the sternum. What is this top part of the sternum? Manubrium. Yes, manubrium. This is the body of the sternum. This is the xiphoid process. Churi tip. Alright. You can see the ribs. Okay. No issue about this first rib, no? First rib and the second rib. Can you see the first rib is attached to the manubrium? No problem. The second one is නිකන් in the middle. Manubrium එකටත් පොඩ්ඩක් set වෙලා දිනවා, body එකටත් චුට්ටක් set වෙලා දිනවා. Right? It's half around. The next onwards, the ribs are directly connected to the body of the sternum. The problem starts from this point onwards. This is called costal cartilage. Anything to do with the ribs, we call it costal. The muscles in between ribs are called what? Intercostal muscles. So the cartilage connecting ribs is called costal cartilage, right? So you can see the ribs are not actually directly connected, they are connected by cartilage, right? Up to the seventh vertebra, this is the seventh rib. This is the seventh rib. Can you see? Seventh rib. Up to the seventh rib, they are directly connected by their cartilage to the sternum. Their cartilage starts here and goes up to the sternum. 8, 9 and 10. This is 8, 9, 10. They are connected through the cartilage of the 7. The maker is 7. Make a 7. This is not their own. They are having like a product join වෙලා ඉන්නවා with the cartilage of the 7. They, we call them as false ribs, right? 8, 9 and 10. Then, 10 වුණාට, where's the other 2? Only 10. So where's the other 2? They are what we call as floating. Main then connect වෙන්නේ. they are not connecting anteriorly to the sternum කොහොමද directly indirectly කොහොමදවත් connected නැහැ. They are called floating ribs. Right? So 11 and 12, this is 12 rib, this is the 11th rib. They are called floating ribs. Can you see? Floating ribs. Okay. Got it? Clear about the sternum? And ඔයගම චුට්ට muscles ටික attach වෙලා තියෙන හැටිත් පෙන්නන්න. Right? So this is the anterior abdominal muscles, right? Before that, can you see the diaphragm? Within a muscular dome එක වගේ this is the diaphragm නේ. Can you see the diaphragm anteriorly? මෙන්න මේ චුට්ට මෙන්න බලන්න. It is attached to the xiphoid process. Can you see? At the front, it is attached to the xiphoid process. Diaphragm. We are looking at the diaphragm from below. යටින් උඩ බලනවා, right? Can you see? It is attached to the xiphoid process. If we add some more muscle, can you see? These are the six-pack muscles. Rectus abdominis කියලා කියන්නේ. They are also attached to the xiphoid process. Online people, can you see? Rectus abdominis, this is the xiphoid process. No? Too much. දැන් ඔලුවට යන්නේ නැහැ වගේ. What is the situation? ඔලුවට යන්නේ නැහැ වගේ. Right? So those are the relations of the sternum, how the ribs are attached and everything. Okay? Shall we write down small thing? නිදිමතක් set වෙයි වගේ. Right? So ribs, shall we read about the ribs? 79, page number 79. Okay, highlight. 12 pairs of ribs from the lateral walls of the thoracic cage. They are elongated curved bones. They articulate posteriorly with the thoracic vertebra. Highlight posteriorly with the thoracic vertebra. And now we are coming to the classification. Anteriorly, 7 pairs of ribs articulate with the sternum directly. So how many true ribs you have? 7. You have 7 true ribs. The next 3 pairs articulate with the sternum indirectly. With the cartilage. The next 3 cartilage with the, through the cartilage of the 7th. So what are the false ones? 1 to 7. 1 to 7 true. We say 8 ඉඳලා 12 වෙනකන්ම false තමයි. Right? But we say in your syllabus we consider 8 ඉඳලා 8, 9, 10. No? 8, 9 and 10. We don't give this name. False කියන එක දෙන්නේ නැහැ. Right? It's not given. No? Right? 8, 9 and 10 articulate with the sternum indirectly. Okay? Highlight. Next 3 pairs articulate with the sternum indirectly. In both cases, costal cartilage attach the ribs to the sternum. Lowest 2 pairs do not with the sternum at all. Right? 11, 12, we say floating ribs. The true ribs Directly with their costal cartilage, the true ribs are connecting with the sternum. False ribs through the costal cartilage of seventh rib. So indirectly. 12 ones, they are not connecting with the sternum directly, the indirectly, the කොහොමටවත් connect වෙන්නේ. Okay. Then we have to know a little bit about the anatomy of a rib. Rib එකේ parts මොනවද කියලා we have to. Where's the rib? A rib has three parts, right? A rib has three parts. This sort of enlarged part here is called the head of the rib, right? ඔය සුට්ටක් narrow වෙන එකක් තියෙනවා, that is called the neck. ඒක ඔයගලන්ට ඕනේ. ඊළඟට මෙතන මෙහෙම පොඩි බම්ප් එකක් වගේ එකක් තියෙනවා, that is called the tubercle of the rib. Head, tubercle, right? This is called the body of the rib. Body, right? There's a head. There's a, can you see there's a chuti? I'll send this around. There's a tubercle and there's a body, right? So what are they saying? The head of the rib articulates with the vertebral bodies. Facets of the tubercle articulate with the transverse process. So can you remember how a rib fits into the place? So the head articulates with the body. Can you see? Then this is the tubercle. Can you see? This is the tubercle. Tubercle articulates with the transverse process. Right? Again, head articulates with the body of the thoracic vertebra. Tubercle articulates with the transverse process of the thoracic vertebra. මෙහෙම ලස්සන සෙට් වෙනවා මෙහෙම. Right? Go ahead. Thoracic cage, which includes the ribs and the sternum, plays an important role in the mechanism of breathing. Between each ribs, intercostal muscles are present. Highlight intercostal muscles. The first rib is firmly fixed to the sternum and to the first thoracic vertebra. If you want to move something relative to some another thing, so how are we breathing? I'll show you how our thoracic volume increases, right? As I said, our thoracic volume increases, therefore the pressure decreases, so air is sucked in. So to do that, ribs, when we are resting, it's like this. Ribs are going to get straight. එම straight වෙනකොට මොකද වෙන්නේ? They are going to push outwards. When they are pushing outwards, the thoracic volume increases. So when volume increases, pressure decreases and air comes in. Right? But the thing is, this is මං හිතන්නේ this is 7 or 6th rib. Right? So these are the longest ribs. Our first rib is very short. Our first rib එක නිකන් rib එකක් නෙවෙයි වගේ නේ. It's like a flat bone නිකන් I don't have a first rib. It's like a flat thing. Right? That first rib is very firmly attached. මේ වගේ මෙහෙ move වෙන්නේ first rib එක. First rib is a fixed point. So the first rib is attached to where? To the manubrium and in the back to the first thoracic vertebra. So always remember, first rib is like an anchor point. It's like an anchor point. Air, I mean, around the first rib, the entire other ribs move. So first rib is sort of the anchor point, fixed point, and the other ribs expand around it. Right? So that's what they are saying. Therefore, the first rib does not move during inspiration. Highlight, the first rib does not move during inspiration. Because it's a fixed point, when the intercostal muscles contract, they pull the entire rib cage upwards and towards the rib cage, first rib. They pull the entire rib cage upwards and towards the first rib. Okay. Presence of 12 pairs of ribs and the sternum provides protection to the organs such as lungs and heart in the thoracic cavity. Right? Ribs side laterally protect karna, sternum frontal protection එකක් දෙනවා. Right? So most of our important vital organs are located here, no? Without the heart and the lungs immediately. Right? Do you know what is how we resuscitate emergency එකදී ගේන patient කෙනෙක්ව අපි මුලින්ම මොනවද බලන්නේ ආයේ? එයා වේග බලන්න. If he is breathing, right? Breathing impaired ද කියන එක තමයි මුලින්ම බලන්නේ. If your oxygen delivery is impaired for more than few minutes, dead. Right? ABCD කියලා approach එකක් තියෙනවා emergency management. එයාවේ එක open දාන්න ඕනේ block වෙලා තියෙනවා. Second one is again breathing related to respiration. Right? Third one තමයි circulation. එයා හෙනට bleed වෙනවද එහෙම නැත්නම් is there any damage to the heart or whatever we are considering තුන්වෙනියට. Right? So it is very important to protect your lungs because not having gas exchange for more than few minutes is going to kill you. More than bleeding. Right? We can do something, but if you can't get oxygen, that's a problem. Right? If your lungs are damaged, if your lungs are filled with blood, okay. Right. Contribution of the human axial skeleton to maintain upright posture. First point, presence of two primary curvatures and two secondary curvatures in the vertebral column. Then development of two secondary curvatures in the vertebral column mainly contribute to maintain erect posture. Size of the vertebrae, especially the body of the vertebrae, become larger towards the end of the vertebral column as they have to support the weight of the upper body. Sacral vertebrae are fused to form a triangular shaped large sacrum to support the weight of the vertebral column. The two occipital condyles and the foramen magnum are located inferiorly at the base of the skull, close to the center. In upright position, this arrangement permits proper balancing of the skull on the vertebrae. Got it? Those points, if they ask you, you have to mention. In structure, they say they can ask you how the axial skeleton contributes. Okay? Right. So, at this point, we have two options. We can finish appendicular skeleton on this Sunday. What shall we do? We can discuss questions in the remaining time because I think before 7 we can't finish appendicular skeleton. I want to go in. I don't want to rush it. Right? What do you say? Shall we finish on Sunday? What do you suggest? Oh, this for the new people? Do you want to finish within today? Okay. Right. Let's try to do maximum. Online people, what is your opinion? Why not take the man that there in a curve? Right? Yes. Okay. Let's see the maximum we can do. Right? So clear about axial skeleton. Okay. How the central structure, starting from the skull, vertebral column, the ribs, and the sternum, everything gets together to act as the midline, no? As the midline. Yes. So now we can move on to the connection between the axial skeleton and our limbs, right? How our limbs are connected to the axial skeleton. That happens in two places. Upper limbs, that is called the pectoral girdle. Lower limbs, pelvic girdle, right? So let's talk about the pectoral girdle first, right? Pectoral girdle has two parts. I mean, two bones. They are clavicle and what? Scapula. The clavicle and the scapula are the parts of the pectoral girdle, right? So through the pectoral girdle, what happens? The upper limb connects to the axial skeleton, right? If you, I mean, actually, your pectoral girdle only connects to your, I mean, skeletally only connected to your axial skeleton by the clavicle. Right? Clavicle එක විතරමයි connection එකට තියෙන්නේ. Your scapula is actually very mobile. Right? When you are moving your arm like this, your entire scapula comes. Shoulder blade එක වෙනවනේ ඉස්සරහට. Right? මෙහෙම අත් දෙක බැඳගත්තාම you can see the shoulder blades coming outside. Pelvis එක එහෙම වෙනවා. No, pelvic bones are not moving. It's a very stable structure. Right? But your scapula are moving. Because why? More than a bony connection, right? There's only the clavicle. That's the clavicle. There's only clavicle connecting our scapula to the sternum, right? This scapula is actually floating. Only muscles. There's a lot of muscles connecting to the scapula. These all these colored areas are to indicate places muscles are attached, right? So your scapula has a lot of muscles. In the living person, the scapula is stabilized by the all the muscles connected, right? Bones වලින් stabilize කළාම නැති තරම්. It's almost entirely stabilized by muscles, right? Okay. So that's one thing. What is the advantage of not having that many bony connections? It's very mobile, right? Because of the mobility of the scapula, it has increased the mobility of the entire upper limb, right? You can't move your leg like that. No? මෙහෙම ඉස්සරහට like punch එකක් එක්කම you can't send your you can send your entire shoulder forward. මුළු shoulder එක forward යවන්න පුළුවන් backward යවන්න. That is because your scapula is very mobile. That's one of the interesting things about pectoral girdle. Okay. The lower limb forms a joint with the trunk at the pelvic girdle. Pelvic girdle is composed of the two hip bones and the sacrum. Pelvic girdle, two hip bones. එම hip bone එක කියලා එකක් ඇත්තටම we don't have. It's like it's a fused three bones. මෙතන bones තුනක් තියෙනවා. Those are fused, right? Ilium, ischium and pubis. Yes. But in your syllabus you consider it as one hip bone and the sacrum. මෙතන එහෙම සෙල්ලම්. In the pelvic girdle, mobility has been sacrificed for what? What are we exchanging mobility with? Strength, right? Because it's immobile, the pelvic girdle is able to hold the entire body weight. You can do squats. You can, I mean, you can run with your entire body weight for a long time, right? You can, I mean, particularly squatting strength is very high, right? You can bear your entire body weight easily, no issue. Because why? Your pelvic girdle is very stable. But why do you need so much mobility in your upper limb? Because we work with our upper limb and we move with our lower limb. No? So for the lower limb, what is the importance? Strength. Upper limb, mobility. See how the evolution has worked, right? Pelvic girdle is very strong. Pectoral girdle is very mobile, flexible. Right? And clavicle, there's a diagram of a clavicle, right? I have shown you the clavicle, right? One end of the clavicle articulates with what? This is the end that is articulating with the scapula, round end, and the sort of pointy end is the articulation with the sternum, right? You can look around. clavicle. Clavicle is one of the let's say one of the only bones අපි මේ fracture වුණොත් හදන්නේ. If you get a clavicle fracture, do you මෙතන තනි cast එකක් දානවද? Right, forearm හරි කොහේ හරි fracture එකක් වුණොත් what do? You put a plaster of Paris cast එකක් දාලා you make it immobile until you heal it, right? If you get a clavicle fracture, we don't even do a surgery to correct it, right? Because why? It's not very important for stability. Fracture වෙලාම තිබ්බත් කමක්. But if it's like a cosmetic issue, sometimes the two pieces can come out like this, right? එතනින් එහෙම නිකන් notch එකක් වගේ පේන. If it's cosmetically, if it's a problem, they do a surgery, but not in government hospitals. Government hospitals, we don't do clavicle repairs because it's not essential, right? In government hospitals, what don't we do? Cosmetic operations we don't do, right? If you have a clavicle fracture and if you want to get it fixed, you have to do it private, right? We don't do clavicle fracture fixing, okay? Right? අඩාගත්තොත් private hospital එකට තමයි යන්නේ. Clavicle fractures are very common. අර සාමාන්‍ය පඩි පෙළෙන් එහෙම වැටුනාම clavicles එනවා, motorcycle accidents වලින් ගොඩක් එනවා. Right? Clavicle fractures are very common, but we don't usually fix it. Right? Painkillers dila, it's just going to heal there. Okay? Neat. Moving on to the upper limb. Very, very interesting. Right? Upper limb. Before we move on to the upper limb, clear about the ribs. Right? Okay. We need to know about some names that we give for body movements. Some names that we give for body movements. Okay, මේ නම් ටික I think කෙනෙක් පටල ගන්න නැතුව මතක තියාගන්න ඕනේ, because whenever you are describing a joint, you have to describe it what you can do at that joint. නිකන් joint එක නිකම්ම කියලා හරියන්නේ නැහැ. What can you do at that joint? What are the movements you can do? Right? So movements at a joint, there are several. First one, abduction. සාමාන්‍යයෙන් අපි we consider our shoulder joint to be the joint that is able to do all the movements, right? All the possible movements at a joint, our shoulder joint is able to do. Abduction කියලා කියන්නේ our hand is like, our arm is like this and we are raising it away from our abduct, right? Away from our, okay? So මෙහෙම තියනවා නම් we are raising it up like this. Abduction. මේක අනිත් එක මේ B එක වෙනුවට D එකක් දාන්න, adduction. Adduction කියලා කියන්නේ මේකේ opposite. arm එක මෙතන තියෙනකොට we are going to bring it close to our body. මෙහෙම නම් තියෙන්නේ bringing it down. Adduction. Okay? Adduction. අපි flexion කියලා එකක් කියනවා. Flexion means we are moving the hand, moving the arm forward. Flexion. මේ ඉස්සරහට. right? අපිට ඒක මෙහෙම abduct කරලා තියෙද්දිත් ඉස්සරහට යවන්න පුළුවන්. නැත්නම් මෙහෙම තියෙද්දිත් ඉස්සරහට. Right? Flexion. The other one is extension, means flexion is opposite. Past. And past down again, extension. Okay. Then the other one, circumduction. Circumduction. රවුමක් අඳින්න පුළුවන්. Circumduction කියන්නේ මෙහෙම රවුම. Finally, there's something called rotation. Rotation means, to see rotation, මෙහෙම තියෙද්දි මෙහෙම කරකවන්න පුළුවන්. It's easy to see මෙහෙම තියෙද්දි. මෙහෙම යවන්න පුළුවන් මෙහෙම. Rotation. Shoulder within the joint, I can rotate. Rotate it. මෙහෙම තියෙද්දිත් පුළුවන්. Yes. This is shoulder rotation, right? Eka confusion mehema circumduction එකත් එක්ක. ඒක we are drawing a circle, right? This is rotation. එනිසා මෙහෙම තියෙනකොට ඒක lazy ඉන්නේ, right? Rotation. Any people any questions? Let's go to the software and see, right? Upper limb. So movements at a joint, it's very, very interesting, right? So let's relate it to the shoulder joint first and then we can see, right? So what is the first one I told you? Abduction, 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 like this, right? Mega, this one is better, right? Can you see? We are raising the shoulder outwards. Can you see? This is that one. This is the better one. Can you see? We are raising the shoulder outwards. Abduct. Abduct. All people, can you see? Arm laterally away from the body. Right? Abduction, abduction, abduction. මෙයාගේ opposite කවුද? Adduction. අපි අත මෙහෙම උස්සලා තියෙද්දි we are bringing it close together. Adduction. A double D duction, adduction. AD duction. Okay. What is the other movement? Shoulder movements. There's no circumduction. This is shoulder flexion. ඉස්සරහට. මෙහෙම නිකන් හේල් හිට්ලර් කරනවා වගේ, right? right? We are raising the arm forwards like this. Flexion. Right? එහෙම මතද යන්නේ, right? මොකක් හරි මගුලකින් flexion is moving it forwards. Right? It's the opposite of it is extension back swing. කළා මතද යන්නේ ඕනේ actively මොලේට දාගන්න. ඒකතන වාඩි වෙලා බෑ නිකන් පාඩම් කරනකොට ඔහොම කරන්න. This is abduction, this is flexion. Okay, great. Then rotation. There's two sides. මෙහෙම අපිට ඇතුළට rotate කරන එකට we call it medial rotation, right? මෙහෙම ඇතුළට and the එළියට කරන එකට external rotation. මේක මට ගන්න අමාරුයි. It depends on the flexibility, right? Okay, internal rotation, external rotation. You can call it lateral rotation. ඔහොම අත එළියට rotate. Okay, clear. Rotations. Circumduction to show you circumduction. මෙතන මේකම පෙන්නන්නකො ribs වැඩ කරන හැටි. Can you see the ribs? It's not that much of a big movement. Can you see how the thoracic volume is increasing? Ribs are moving on ඉස්සරහින් balloon. Ribs are moving outwards and forwards. Elliot, right? Outwards and forwards. Okay, that's how we are breathing. So this is the opposite one. Scapular movements you don't need. Forearm. Megam, I'll show you how our forearm works. Our forearm, if you think about it, it's very weird. We have two bones in the forearm. When you are turning the hand other way, you actually cross your bones. Bones cross, right? The bones are forming a X shape, right? Bones are crossing over each other. Got it? And then let's talk in detail about the upper limb, Megam. This is the funny bone, right? It's the humerus, right? Humerus, right? It's the arm bone, upper arm bone. These are our forearm bones, right? The inner one, this is called the ulna, and the other one that is sort of located outside is called the radius, right? These are our wrist bones. These are called what? Carpal bones. Right. Right. These are called your wrist bones, right? There are චුටි bones ගොඩක් තියෙනවා, right? It's even though we only see it moving like this, there's a whole bunch of bones here. How many? Seven. Seven? Eight, no? Eight carpal bones, yes. Eight carpal. Right? Eight carpal bones. And these are your hand bones. We call them metacarpals. Maybe 1, 2, 3, 4. Palm megati. Right? Palm megati, you have metacarpal bones. In the wrist, you have carpal bones. And on the end, we have phalanges. Phalanges. Per finger, how many phalanges? 2. Except for the thumb. 2. 2 phalanges for the thumb. අනිත් මේකටම 3 ගානේ තියෙනවා. palm එකේ අපිට හැංගිලා තියෙන්නේ කවුද? In the palm, what do you have? Metacarpals. 1, 2, 3, 4 and මෙතන එකක් තියෙනවා 5. In the wrist, between your forearm bones and the metacarpals, carpals, wrist bones, right? They actually some are locked in place. මෙන්න මේ row එක වගේ එක they are not moving, right? But this row between our radius and ulna, they are able to move, right? අපේ wrist එකෙත් we can do some movements. We can flex it, we can extend it. Accelerator අල්ලනවා extend කරන්න පුළුවන්. and අපිට පොඩ මෙහෙම side to side කරන්නත් පුළුවන්, right? Side to side කරන්නත්, right? And we can මෙහෙම bit of circumduction කරන්නත් පුළුවන්, right? Okay. Online people, can you hear? Yeah, the rain is a bit of a problem, no? Yeah. Okay. Upper limb. Questions? Clear about the movements? Come to resource book. Page number 81. Upper limb consists of humerus. What is the list of bones? List of bones. You need to know the numbers and be able to. After this lesson, you will be able to label all the bones. I think 208, ne? 208. There's a 207, 206 or 8. ගාන හදලා බලමු, right? Upper limb, at your level also you are going to be able to name all the bones in the body. ඔක්කොම පුළුවන්. Upper limb starts with where? The humerus. That is the upper arm. Forearm, you have radius, ulna. Wrist, you have 8, no? 8 carpal bones. In the palm, you have 5 metacarpals. How many phalanges are there? 3 4 12 and 2 14, right? 14 phalanges. Total here. 1, 3, 11, 16, 30. Total here. 9, 11, 16, 30, no? 30? Yes, right. 30 bones in the upper limb. Okay. Okay. Let's read about the upper limb. Structure of the upper limb is adapted for grasping, weightlifting, movement over a wide range. Head of the humerus, the bone of the upper arm, forms an incomplete ball socket joint. It's a very, very important point. Highlight incomplete ball and socket joint. Where do you see the complete ball socket joint? Ball and socket this is a ball. This is a ball, no? Right? Where does it fit into? Into a socket. This is a nice socket. Nicely fits into it. This is what we call as a complete ball socket. Can you see it's a very deep socket and it's a nice, almost a full spherical ball. No? This is a complete ball socket. Sorry? Excuse me. Sorry about that. Where are we? Ball and socket, no? So, the perfect example for the ball and socket joint you can find in the pelvic girdle, but not in the pectoral girdle. Why? If you make, again, a hammer there's a compromise. If you get something, you are going to let go of something else. What do you get in such a joint? A lot of stability, a lot of strength. Make a malara dislocate karna baya, right? A lot of stability, right? It's a very strong joint, right? But the other thing is, when මේ ගන්නට විතර extend කරන්න ගියොත් you get bony prominences touching, and also there's a lot of ligaments. You can't do a lot of mobility. මෙහෙම පස්සට යන්නත් බෑ. There's, because of this cavity is very deep, the socket is very deep, the range of motion is limited, right? But it's very strong. Okay, you can see a ball and socket joint in your shoulder, but where is the socket? When I socket type in the scapula, there is not even a socket. It's like body surface එකක් විතරයි. But there's a ring of cartilage around it, right? There's a ring of cartilage, so it's not bony hinda you can't see, right? It's called the labrum, but it's a very shallow, right? It's a very shallow socket. So who is articulating with this? The humerus. The humerus has a ball, but if you compare it to the femur, it's not a complete ball, no? Right? Only a hemisphere වගේ නේ භෝගයක්. Sorry, බෝල භාගයක්, hemisphere, right? This is almost 1/3 වගේ, right? So that's why we say that's a incomplete ball socket between what? The scapula and the head of humerus. Incomplete. But because it's incomplete, it's very mobile. ඕනෝගලක් ගන්න. right? මේව ගන්න පුළුවන්. and මේක ඇතුලේ මෙහෙම internal external rotate කරන්නත් පුළුවන්. right? මේ හිප් එකේ එහෙම පොඩ්ඩක් කරනවා මෙච්චරයි කොච්චරයි. ඒකත් මේ ගොඩක් වෙන්නේ කොහෙන්ද? ඉන්නව knee. right? In our hip, the mobility is very low, right? Because of this incomplete ball and socket joint, mobility is high, but what very commonly happens in the shoulder? Shoulder dislocations. Shoulder එකපාරක් dislocate වුණොත් you are prone to dislocate it again and again. Because what happens? There is no bony stability to it. Because there's no bony stability, only the ligaments are keeping the humerus in the socket. So if you dislocate it once, the ligaments are going to stretch. Ligaments take a stretch to කියන්නේ. You are going to keep getting shoulder dislocations again and again. Okay. Right. Shoulder joint. So where were we? Head of humerus forms an incomplete ball and socket joint in the glenoid cavity of the scapula, permitting a vast range of movements. Right? Yes, I forgot to mention. This socket is called the glenoid cavity. Highlight the name, glenoid cavity. It's called the glenoid cavity. Yeah? Glenoid cavity. The joint allows highlight, put numbers, flexion, extension, adduction, abduction, rotation, and circumduction. මේ list එකම කරන්න පුළුවන් shoulder එකේ. Can you see? All the movements are possible, right? At the shoulder joint. Then we can move on to the next joint. Shoulder right? What is the next joint? Elbow. Humerus. How do we usually describe a bone? Something that is close to our head is what we call as proximal end. අපිට අපේ point of view එක මොකද අපේ S දෙක, right? අපේ S දෙකට closest point of view එකේ තියෙන එක we usually call it a proximal. Something away, distal, right? So this is the proximal end of the humerus. This is the distal end. You have to be able to describe these like this. Okay. So on the distal head, we have two articular surfaces. For what? For the two bones, the two forearm bones, radius and ulna. Ulna joins here. When ulna, right? Ulna has this sort of spanner එකක් වගේ මෙහෙම you can fit it into the, there's a groove for in the humerus for the ulna. Ulna, there's a prominence here. Ulna bone එකේ මේ prominence එක. මේ elbow එකේ මේ point. This is this. Can you see in the ulna bone? This one, na? මේ උල නෙවෙයි මේ right? Can you see? There is our elbow prominence. This, right? So your ulna connects like this, and your radius is a left humerus like this, right? Radius and the ulna connects like this. So what are the movements that you can do at the elbow? You can only flex and extend. Flex and extend විතරයි. මෙහෙම මුකුත් කරන්න බෑ. Right? Circumduct කරන්න එහෙම මුකුත් කරන්න බෑ. Elbow is a very stable joint. Only two things you can do. You can extend it and flex it. Got it? They articulate with the carpal bones at the wrist. I mean, so at the distal end of the humerus, they articulate. So here they articulate at the elbow joint, and on this end, what is at this end? May end again, the wrist. There are carpal bones, no? Further, the radius and the ulna articulate with each other at the proximal and distal radioulnar joints. ඇත්තටම මේ දෙන්න they articulate with each other. What happens when your hand is like this? So මෙන්න මේ වගේ දැන් these two bones are like this when my hand is like this. මෙන්න මෙහෙම තියෙනවා. What is going to happen if I want to turn my hand like this? හොඳට බලන්න, right? So this is my hand. What happens if I want to turn my hand like this? Is what palm up එකට මොකද කියන්නේ? Supinated. What do I want to do if I want to pronate? Always keep the elbow නිකන් මෙහෙම හරවනව නෙවෙයි, හරි? Elbow එක එක තැන. Can you see? Elbow doesn't change. What are we doing? Only the hand. Only the hand. So if you are moving only the hand, what is going to happen? The two bones are going to cross each other like this. මෙහෙම cross වෙනවා. So in a pronated position, මෙහෙම pronated තියේදී you will see that your radius goes like this and the ulna goes like this. Cross වෙලා. හැබැයි අපිට මෙහෙම cross වෙන්නේ නැතුව මෙහෙම හරවන්න පුළුවන් from the shoulder and the elbow, right? But what we want to do is මෙහෙම හරවනවා නම් the bones are going to cross like this. Okay. In addition, a fibrous joints connect the shaft bones along their shaft. Highlight a fibrous joints. Then may bones දෙක මෙහෙම සෙල්ලන්නට දීලා ඉන්න බෑ. Highlight the word fibrous joints. In between these two bones, I think you saw there's like a sheet of fibrous connecting these two bones so that they are stabilized. ඒගොල්ලන්ට එහෙම වැඩිය බෑ. They are just only allowed to cross each other විතරයි. Right? They can't be allowed to move like this, right? It's going to sort of make it less stable, no? Right? So they are only allowed to move relative to each other. So they are stabilized along their shaft by a fibrous sheath කියලා තියෙනවා. Yes. Right? Fibrous joint, no? Elbow joint act as a hinge joint which permits only flexion and extension. Highlight. Elbow, only flexion and extension you can do. Only you can do flexion and extension. Carpal bones, how many are there? 8, right? Carpal bones, there's 8, right? There's a mnemonic, so I think scaphoid, lunate, triquetrum, මොහොම 8ක් තියෙනවා. Okay, pisiform to trapezoid, right? There are 2 rows. 8ක් තිබ්බට they are arranged in 2 rows. So how do we describe the 2 rows? අපේ head එකට close එක proximal row, away from us distal row, right? Where do you have the wrist joint? Wrist joint itself කොහෙද තියෙන්නේ? Right? Proximal row එකයි radius and ulna. Between mostly the radius. Can you see if you take a look at the radius, මේක තමයි radius එකේ proximal end එක, elbow side එක. මේ තමයි radius එකේ wrist side එක, distal end එක. Can you see it's wide? So our wrist joint එකේ mainly ඉන්නේ radius. Okay? Our wrist joint is mainly radius. Can you see? ulna එක චුට්ටයි යන්නේ. Wrist joint is mainly radius. Highlight, proximal row bones are associated with the wrist joint. Right? They can ask you what row of the metacarpal bone, carpal bones form the wrist joint? Proximal row, close to your body. Ne? The distal row form joints with metacarpal bones. Can you see? And the next sentence is the most important one. Wrist joint is present between the distal end of the radius. Radius කියන එක highlight කරලා ප්‍රතු කරලා කොටු කරලා, right? Radius forms the wrist joint. And the 3 proximal carpal bones. Proximal carpal bones and the radius forms the wrist joint. If you want, you can write it down, star marks, right? Wrist is formed between the 3 proximal carpal bones and the radius. So this whole arrangement of these forearm bones at the elbow and at the wrist allows the pronation and supination, right? In addition, the wrist can be flexed, extended, abducted and adducted. So what is flexion? Flex. Extension, accelerator අල්ලනවා වගේ extend කරනවා. Abduction is away, I think. Yes, make a abduction. This is adduction. Okay, මෙහෙම ඉන්නකොට abduction, adduction, right? Next paragraph. Proximal end of the metacarpal bones in the palm articulate with the carpal bones. Metacarpal වල carpal bones වල distal row එක articulates with the hand bones. Sorry, palm bones, no? Palm එකේ තියෙන bones 5 metacarpals, right? මෙහෙම 5 metacarpals. The joints between metacarpal and phalanges allow movement of the fingers and permit the power grip. Grip. Next important topic, grip. All right. Grip. There are 2 types of grip. There's a power grip and there's a precision, or you can say fine grip. For the power grip, you only need actually your 4 fingers. May fingers අතර තිබ්බ නම් right? Whenever you're doing like a pull up or something, right? You thumb එක ඕනේ, right? When you're hanging on a bar or something, thumb එක නැතුව අල්ලන් ඉන්න පුළුවන්. Like almost 99% of your hand can be generated with this 4 fingers. This is the power grip, right? Or ඕනම දෙයක් tightly අල්ලන්න, you don't need the thumb, right? මෙහෙම tightly අල්ලන්න without the thumb. Thumb is there just to නිකන් පොඩි sure එකක් දෙන්න පොඩි නිකන් fit එකකට. Without the thumb you can grip anything, no? That is power grip, right? 4 fingers. Precision grip එකට you need the thumb. Thumb is the main role in precision grip. So if you What is precision grip? How we hold a pen, how we hold like a sort of a drawing brush or something, right? Precision, right? We need the thumb. Why is thumb so important? Our thumb is able to move in the opposite direction of the other fingers. අපිට පුළුවන් using our thumb we can touch each of our fingers. Have you ever appreciated this? Only us and the chimpanzees can do this, right? Opposable thumb. It's called the opposable thumb, right? Our thumb can move in the opposite direction. අපිට ඕන finger එකක් එක touch කරන්න, right? That is why we have a precision grip. That's why we can do so many precise, fine, small things, right? That's because our thumb is opposable. That opposable nature was given to the thumb by a special joint between carpal bone. There's a special carpal bone here, and this is the what is the bone that we have at the base of the thumb? First metacarpal. So can you see? It's not මේ මුල් ටික විතරක් නෙවෙයි යන්නේ. The entire thumb you can, right? Have you appreciated this? This entire thumb එකේ base එකේ ඉඳලම you can move. The entire metacarpal is moving at the wrist, right? The entire metacarpal is moving. So that's what it says in the resource. The joint present at the base of the thumb between a specific carpal bone and the first metacarpal, highlight, right, allows more mobility to the thumb than the other fingers. They can ask you this: what is the property? I mean, let's say what is the feature, or let's say what gives the thumb more mobility? The joint present between the base of the thumb between first metacarpal and a specific carpal bone. This leads to opposable nature, highlight, which permits the thumb to move in perpendicular to the other fingers. This allows precision grip, which is unique to man. So I think chimpanzees also have. I'm not entirely sure. I think chimpanzees have. Okay. Right. So lower limb, I think we don't have time. No. So let's do one more MCQ and then we can finish for the day. Right. It's the rain has stopped. I think it's good to send you home. Right. In your tute, did we do question number 28 කියන එක? Before starting of the structured essay questions, question number 28. Which of the following statements regarding axial skeleton of man is correct? No, quickly do it, then we can chapter close. What's remaining is lower limb, arches of the foot, and types of joints and diseases. No, few diseases affecting the skeletal system. That is at least going to take another hour. Right? I think I spent a bit more time on skull ටිකක් වැඩිපුර time ගියා නේ. But you need that 3D idea, I guess. Right? One. Fast. Online people, what's the answer? You didn't find the question. Question number 28 කියලා තියෙන්නේ. There's no other 28, right? Yeah. Which of the following statements regarding axial skeleton of man? Okay, I got one answer. Right? What's the answer? Yes. Okay. Hmm. Three pairs of ribs articulate with the sternum indirectly. Yes. Or monkey. We don't call them folds, but they articulate through what? Seventh rib ki through the costal cartilage of the seventh rib. So those are indirect. Right? Zygomatic arch provides surface for muscle attachment for the movement of the upper jaw. Upper jaw ekata? What do you think? Yeah, you can't move your upper jaw. Right? What is another name for the upper jaw? It's the maxilla, no? Maxilla. Sacrum is formed from 7, no. Correct it, 5, no. Sinuses are located in the nasal and temporal bones. Nasal bone nagidak ne. Sinus kartane chuti ke. Right? There's no space. Right? Even in the temporal, there's no. They come where? Right? Until the development of the lumbar curvature, child cannot hold the head upright. What do you need for the head? Cervical. Correct it? Cervical. No? Okay. So structure is a questions are your home. Okay. Do you have any question that you want to ask? Hmm. Okay. Online people, then we can finish for the day, right? So that concludes this free session, right? Uh, so I'll keep you for future upcoming seminars in the same bone seminar group, right? So I'll send the recording to that as well. Yeah. So join with our future programs if you want. You can join with our rapid theory and the rapid revision, and also the paper class will be starting probably next month. I mean the separate paper class. We are doing papers every month, right? Okay. Thank you. You are welcome. Good night.